Namaha. Shri Dhanvantri Namaha. Welcome to Indian Institute of Ayurveda and Rasa Shastra. This is Dr. Pallavi M. So, and we have Dr. Nagveni with us to welcome all of us in the forum of Indian Institute of Ayurveda and Rasa Shastra. We welcome you all to the e-learning platform of Indian Institute of Ayurveda and Rasashastra. IIAR was inaugurated by Siddhinandan Mishra sir in 2018 at Ballari, Karnataka. The institute hopes to teach students and Vaidyas the basics and the clinical applications of Rasashastra. We are overwhelmed to complete one complete year of this e-learning platform. This could happen only with the blessings of Professor Siddhinandan Mishra sir, compassion and dedication from our chairman and co-founder Dr. Gopi Krishna M, constant support of Dr. Srilalani Chunkat and Mrs. Vasanti Gopi Krishna, zeal of our guest speakers who are a very big part of our one-year journey, teaching us different topics, different clinical aspects in different perspectives, and helping our delegates and us to learn more about this science. And the quest for knowledge of our delegates and our best team. And last but not least, our moderator team, that is Dr. Jyoti Verma and myself. On behalf of all the participants, firstly, we would like to wish our Guru, Dr. M. Gopi Krishna sir, a happy birthday. Lord Shiva bless him with good health and wealth. Happy birthday, sir.
Thank you. Thank you.
And also wish Dr. Jyoti for her birthday as well.
Thank you, sir. Thank you, ma'am. Happy birthday, sir.
Dr. Nagveni, is there any issue with the unmuting? You can unmute now. Yeah.
Sorry, everyone. Good morning, everyone, and a happy anniversary for the IIAR.
Yes.
So now let us start the program by taking blessings of Almighty, and I request Dr. Pallavi ma'am to chant Dhanvantari Stha.
Om Namami Dhanvantarim Adidevam Surasurai Vandita Pada Padmam Loke Jararubhaya Mrityunasham Dataramisham Vividaushadhinam Dhanvantari Ramanatha Sarvaroga Nivarakam Ayurveda Pravattaram Vande Piyushadayakam Sarve Jana Sukhino Bhavantu Sarve Santu Niramaya Sarve Bhadrani Pashyantu Ma Kaschit Dukkha Bhag Bhavet. Om Shanti Shanti Shanti.
Thank you, ma'am.
Thank you, Dr. Nagveni. If Dr. Can we ask Siddhinandan Mishra sir could join? Or can we continue?
Still is having a technical issue.
Okay.
Yeah.
So we will continue. Shubham karoti kalyanam arogyam dhana sampadam Shatru buddhi vinashaya deepam jyotir namaste. Salutations to the light of the lamp, which brings auspiciousness, health, and prosperity. The lighting of the lamp removes the negativity from the house or the environment and gives positivity elsewhere. I request Dr. Govindarajalu sir, father of Dr. Gopi Krishna, Dr. Gopi Krishna sir, and Mrs. Vasanti Gopi Krishna's ma'am to light the lamp to mark the start of the gathering. I also request all the delegates to please light the lamp or the diyas which you have kept in your house for the procedure.
Yeah, director. Yes, ma'am.
I may now request Dr. Gopikrishna sir to welcome the gathering.
Yeah. Thank you, Dr. Nagvani. Also, I thank every person who has been here for today's anniversary celebration. It's really great, and it's a sort of a great blessing for us, for the whole team of IIAR, that all of you have joined your hands to make this more successful. And I'm very happy to welcome all of you for the anniversary celebration of Indian Institute of Ayurveda and Rasashastra. The fest is begin. It will go ahead. All the tiny steps, like what this morning I was very happy to read Sheila ma'am's message. The baby was born, and it's the first birthday of the baby towards conquering the disease through Rasashastra. So we will conquer one after the other. Definitely, we will do more of achievements in respect to the pain management and also to the various disorders. So thank you one and all for being with us, and we shall open the session for today's celebration of Indian Institute of Ayurveda.
Thank you so much, sir. I now request Dr. Pallavi to
Yes.
present the year report.
Thank you, Dr. Nagvani. So it is my privilege to give a details regarding our year report, because from the day we started, we felt like, okay, what we are doing, I don't know how they will respond. Like, we will get the responses, we'll see the people, or they will be interested in online classes. There were so many things going on in our mind when we started, but it was such a happy thing when we started. In our first session, we could see more than 500 delegations for the paid courses. So it was a very overwhelming situation for us, because like stepping into something and we don't know how the route is, how the path is. We will find stones, will how we have to travel and all. It is very difficult. So that journey was made very easy from our delegates. We could get a very good response from everybody. We could host more than 40 free sessions, which include the many of the geological classes by Dr. R.V. Karan sir, which include petrographic technical methods for identification of minerals, and basics of mineralogical identification, earth structure and importance of earthquake. Being a Rasa Shastra person, geology becomes a part and parcel for us. So these classes were so helpful for us and the Rasashastra postgraduates and the learning doctors, that they could get good idea, proper idea. Okay, this copper, how it comes to the earth crust, where it is formed. All those we could learn very beautifully. So we had another speaker, that is Dr. Sambaji Patil sir, who is very well versed in Visha Chikitsa and Dravya Guna, using Dravya single drugs and all, and treating them. We had Dr. Rajalakshmi ma'am, who could give us put much light over the Panchakarma Chikitsa in our clinical practice. Dr. Rajesh Thakkar, a well-known practitioner from Gujarat, he could teach us his experiences, where he could use Rasashastra, Rasaushadis in his emergency practices. We could have sessions from Dr. Prahlad sir, who gave us many of the insights on the micro and macronutrients. He could explain us many of the things which could be useful with our anatomical aspects. And we had Dr. Gopi Krishna, yes sir, from Kerala, who could teach us on the specific Agada Chikitsa for specific disorders. We had Vinish Gupta sir, who had a very good hold on the treating of the COVID conditions and the emergency COVID conditions. And Anumeha madam, who gave us Karnavedha Chikitsa for Tamakashwasa. We had Shivakumar sir, who could give us treatment over gallstones. Naveen Chandra sir, who explained us on Marma Chikitsa. Ramdas Awad sir, who is a RAV teacher and he is a practitioner in Panchakarma Chikitsa and mainly in the infertility field since 33 years, gave us many of the insights of Panchakarma Vapad. His experiences, like what he faced and if his students had faced and what was the treatment they followed without getting panicked. Because whenever we see Vyapads, we don't think of treatment. We first get panicked. So that is the first thing what we should not do. So those all things were beautifully explained by sir. And Uni Krishna sir from Kerala, who could give us on the retinopathy and management in Ayurveda. We had many of the other speakers like Dr. Raghavendra sir from Coimbatore, who gave us very beautiful insights on spine disorders. Durgadat Vyas, who could give introduction on the Sukshma Aushadhi Kalpanas, which is a different part, which is but beautifully practiced. Dr. Purnima gave us different perspective like the chromotherapy and its clinical utility. That is using colors, how can we treat the chakras, how can we heal the chakras, and how can we maintain the positivity in our clinic for the patient and all those. With these, we could also learn some of the technologicals or the technical aspects by Dr. Rashmi Pujar, who gave us basics on ECG. So we also had speakers who could give us insights on semen analysis, how to perform them, how to analyze and interpret them by Dr. Shruti Bennur. Dr. Uday Talhar, very beautiful practitioner in Agni Karma Chikitsa from Maharashtra. He could give us many insights on Agni Karma Chikitsa, and his only only one sentence he used to tell us, just tum jalate jao, patient theek ho jayega. So you have to best know the points where you have to treat the patient and he'll definitely get healed. So we also had Dr. Shruti M, who could give us some insights on common ailments of pregnancy and the management through Ayurveda. Because ANC has become a very short part in our practice nowadays. Very few patients come to us for the ANC treatment. So she gave us a beautiful insight on this. And Dr. Surya Narayan sir, who gave us on the use of Swarna Prashana for the kids. And we had ample of sessions from Dr. Gopi Krishna M sir on posology, on route of drug administration, we had so many queries. When we started the session, before starting, when Rasa Shastra is used, there pops up many of the question marks. Is it toxic? It is hepatotoxic, it is nephrotoxic, how can we take mercury? So many things pops up in everybody's mind. Being a Ayurveda professional, we will have so many questions. So that discussion was also done in our sessions, that we tried to clear off many of the doubts from the commonly asked questions from our delegates, from our students, and many of the people got the proper insights, proper guidance, that how we have to use, how we have to prepare the medicines, where it is going wrong. So we had continued parts of 3 sessions on the Bhasma Chikitsa, Bhasma in the Chikitsa aspect. And the beautiful session was also conducted on Potali Kalpas, which specifically on the female health. Because Potali Kalpas have become like something like a very special preparations, and people get afraid of preparing it because, oh, Potali, we don't know how to prepare it and all. So that gap, we wanted to bridge that gap, and we took classes on that. So these were our free sessions, and we were so happy to announce that we have completed 12 e-certificate courses. So the first course, and we had totally for the 12 courses, we had more than 1,300 registrations. So we had hosted our first course on Maharasa Varga, in which we sir could explain very detail about Abraka, and it took almost for us to complete about Abraka. So a single drug can do so many miracles. Useful as rasayana, it is useful in respiratory disorders. The combinations and permutations of it can give miracles. Like the Triphala, we can use many of the things. In the same way, when we use Abraka, different combinations can give different therapeutic activities. And next we could host on diabetic management in Ayurveda, which was a basic session, like where we discussed about the sampraptis, the basic clinical aspects. Like Dr. Kashinath Samagandi sir gave us an insight on the yoga and diet practice in the diabetic patients. We have so many myths, like we should not eat this, we should not eat that. And the first myth was taken off from us, saying that taking sugar doesn't cause diabetes. Only taking sugar doesn't cause diabetes, because many of us, when patient comes with, okay, our sugar is like that, then we will tell, stop everything which is sweet. That is not necessary actually. So Dr. Sridhar Bairi sir gave us insights on the kashta aushadhis which can be used for treating diabetic conditions. Dr. Srivatsan Avalur gave us the panchakarma chikitsa which can be done in the diabetic patients, because we have to take care, a specific care when we have a diabetic patients during Svedana, during any of the Virechana Vamanadi karmas, when we have to do, when we should not do, all the things have to be taken care. We had Dr. Mamata KV ma'am, who could give us insights on the diabetic management in the gestational period. So pre-conception and post-conception, how we have to manage, that the insight was given by Dr. Mamata KV ma'am. And Dr. Upendra Dikshit sir gave us few of his clinical experiences in the diabetic management, and Rasaushadhi and the management, and which sort of Rasaushadhis has to be used, where we have to use Potali, where we have to use Kupi, or this combination of a herbo-mineral preparation and all, that was given by Dr. Gopi Krishna sir. On high demand, after the completion of diabetic management, we could launch the next session, which was on advanced course in diabetic management. In this, we could have an exclusive discussion on diabetic nephropathy, diabetic neuropathy, diabetic retinopathy. The complications of diabetic conditions were discussed in this session. Next, we discussed on the respiratory disorders and its management in Ayurveda, because the COVID has covered everybody, and everybody was in fear that, okay, if they have little breathing difficulty, they'll go, I have something and I have to get the oxygen supply. I don't know, something has happened. So what we can manage, how much we can manage and all, we could discuss in this. Next, we launched our course on PCOD, fibroids and tubal blockages, which is a major challenge in female health. Nowadays, the females are like, everybody is prone to so many junk food, lifestyle disorders, lifestyle changes and all. So majorly it has been affecting the females, because they are the baby bearing individuals. So they have to take care a bit more. So we had Dr. Satish Jaliyahal sir from Koppal, Dr. Ravindra sir from Hyderabad, and Dr. Gopi Krishna sir to give us proper insights, like what test has to be done, how we have to detect, how the analysis has to be done, what treatment, what procedures, like treatment protocols has to be followed during this conditions were explained. Coming to the next session, we had a preconception health. So getting a healthy progeny is a very important point, and we, being a Ayurveda faculty and fraternity people, are blessed that we can do many things before the baby is getting, like the before the conception, like the male and female before getting conceived, we can plan like what to be done, what cannot be done. So that things were explained by Dr. Shruti Bennur, and a few of the Rasaushadhis and Rasachikitsa which can be done for the preconception if there are any defects and all, that was explained by Dr. Gopi Krishna sir. We had a session by Dr. Reena Kulkarni, Nayan Kumar sir, Surya Narayan sir, and Rajesh Thakkar sir, and Gopi Krishna sir on child care and cure. We had discussed on respiratory conditions, neurological conditions, and GI conditions for treating the infants. It is a very difficult condition, though, and that was discussed. We had discussed the divine art of Potali Kalpanas by Dr. Gopi Krishna sir, where we had discussed the details about the pharmaceutical and clinical aspects of the Potali Kalpas. Again, we discussed on the Parpati Kalpas to remove the myth that it is only used in the GI disorders, because we can use Parpati Kalpas in many other conditions. Next, we had a session on Vata Vyadhi Chikitsa, a journey from basics to therapeutics. Here we discussed many of the aspects, because Vata Vyadhi is being such a vast topic. We had to discuss from various aspects, from various perspectives. So we had many of the senior Vaidyas like Dr. Tapan Kumar sir, Muralidhar Sharma sir, Upendra Dikshit sir, Raghavendra Acharya sir, Gopi Krishna sir, and Dr. Mohan Goldsmith, who gave us the insight on clinical anatomical aspects for the Chikitsa of Vata Vyadhis. Dr. Guru Mahantesh, who gave us on Panchakarma Chikitsa, and Dr. Jyoti Varma and myself, who gave the details on the use of some of the Rasaushadis, like how they have to be used and their insights. Presently, advanced course on Vata Vyadhi is going on, which is being conducted by Dr. Gopi Krishna, Dr. Mohan Goldsmith, Dr. Ravi Shankar Parvaje, Dr. Guru Mahantesh, Dr. Jyoti Varma, and myself. We are so happy that we have been completed so many sessions, and many more sessions will be going on in this year.
Thank you so much, ma'am, for taking us through the milestones of IIAR for 1 year. I welcome Dr. Siddhinandan Mishra sir to the session for today. And now it is the time to gain knowledge from our keynote speakers.
Just to interrupt, firstly we request Dr. Siddhinandan Mishra sir to address the gathering and bless us.
So my teacher, Professor Siddhinandan Mishra sir, doesn't need any introduction, because any person in the field of Ayurveda should know him. He's a pioneer and is a little god for the department of Rasashastra. He's a great, successful teacher who has sculptured so many students, and I'm blessed to be his student. And I really thank, because he's a person who has filled all this knowledge of Rasashastra and incorporated our minds in this particular passion. तो प्रणाम सर, आपके लिए आपका बहुत हम आभार है। आपका जो आशीर्वाद आपने हमको दिया आज तक, ये जो इंस्टीट्यूट है 1 साल का पूरी होने आया आज, तो हम एनिवर्सरी का सेलिब्रेशन कर रहे हैं। तो इसका इनॉग्रल भी आप ही ने किए थे जब आप बल्लारी आए। तो अभी तो ये फर्स्ट ईयर का एनिवर्सरी चल रहा है ऑनलाइन का, कोविड के टाइम में हमने इसको स्टार्ट किए थे। तो आपका आशीर्वाद चाहिए सर आज, तो आप कुछ आशीर्वाद।
आशीर्वाद तो मेरा है आपके लिए, हमेशा शुरू से ही हो गया है, अब तो कंटिन्यू करेगा
जी
हमेशा, इसलिए आशीर्वाद तो फिर भी आशीर्वाद है आपके लिए, आपके सभी मित्रों के लिए। और मैं तो अब बहुत एजेड हो गया हूँ, 94 इयर्स हो गया मेरा, लेकिन फिर भी मैं आयुर्वेद का कुछ काम करता रहता हूँ। और अभी एक भस्म विज्ञान हरिशरणानंद का एक किताब अच्छी थी, बहुत अच्छी थी, सभी रसशास्त्रियों के लिए वो पढ़ने योग्य है, उसको मैंने पब्लिश करवाया है और उसको आप लोगों को देखना चाहिए। और रसशास्त्र के बारे में तो और कुछ विशेष जानकारी आप लोगों को तो होगी ही, मेरी किताब के बारे में आप लोग सब पढ़े ही होंगे। दूसरी बात है कि कुछ अपना अनुभव आपको सुनाता हूँ। मैंने एक व्यक्ति को आर्सेनिक सेवन कराया और उसके बाद से एक साधु थे जो कि 80 वर्ष के थे, तो मेरे पास आए। मैं 56 की बात कर रहा हूँ। 56 में पटना में आयुर्वेदिक कॉलेज में मैं फार्मेसी वैद्य था, तो उस समय वो मेरे पास आए और मेरे परिवार को जानते थे। तो मेरे दादाजी से उन्होंने चिकित्सा करवाई थी, तो वो साधु हो गए थे, तो आए तो कहा कि उन्होंने कि मुझे आर्सेनिक सेवन करना है। तो मैंने कहा कि मैंने कभी कराया नहीं है, मुझे इसका ज्ञान तो है नहीं। तो नहीं, ज्ञान तो मैं आपको दूंगा, जैसे जैसे आप इसको करें वैसे वैसे आप हम बताते रहेंगे, आप करते रहिएगा। तो उन्होंने हमको 2 तोला का एक आर्सेनिक का टुकड़ा दिया और कहा कि इसको आप अपने गुरुजी से समझ करके शुद्ध कर लीजिएगा, जो पैसा आएगा वो खर्च होगा, मैं दूंगा। तो मैंने गुरुजी से पूछा तो उन्होंने कहा कि इसको 1 किलो दूध में दोला यंत्र विधि से इसको 3 घंटा तक पकाने से शुद्ध हो जाता है। तो मैंने उसका शोधन किया है और वो बिल्कुल उसमें छेद 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 जैसा जब निकाला मैंने, तो बहुत सारा उसका क्षय हो गया था। फिर उसको मैंने रख लिया और फिर उन्होंने हमसे कहा कि आपके पास क्या व्हीकल है जाने के लिए आने के लिए? तो मैंने कहा साइकिल है। तो उन्होंने कहा कि ठीक है, आप मेरे यहाँ आइए और इसका ये हमको सेवन कराइएगा। तो हमने कहा कि हमने कभी कुछ किया नहीं है, तो नहीं हम बताएंगे। तो उसके बाद से उन्होंने क्या किया कि जब मैं उनके पास गया तो उन्होंने चाकू से पेंसिल के जैसा उसको नोकीला बनाया और छिला उसको, और एक कटोरी में लगभग 10 ग्राम से ज्यादा घी रखे हुए थे और एक रुमाल था और बस। तो उन्होंने कहा कि मेरी जीभ को रुमाल से पकड़कर खींचिए और उस पर 1 लाइन आर्सेनिक का खींच दीजिए। तो मैंने वही किया। तो उसके बाद उन्होंने कहा कि बस हो गया आप, और वो घी पी गए जितना भी ये था, 5-10 तोला घी था, वो करीब करीब पी गए। और फिर कहा कि आज का काम हो गया, ऐसे ही आप हमको रोज आइए कर दीजिए। तो रोज उसके बाद से मैंने उनको 20 दिन तक 20 लाइन खींचा और फिर 21वें दिन से 1-1 लाइन घटा करके मैंने उनको ये पूर्ण किया। फिर अंतिम दिन में उन्होंने थोड़ा सा मैंने मसूर के दाना के जैसा उन्होंने आर्सेनिक को तोड़ करके कहा कि ये मेरे जीभ पर आप रख दीजिए। और मैंने उनके जीभ पर रखा तो ऐसा वो कुरकुरा करके चबा करके खा गए। तो एक हमको ये अनुभव हुआ। दूसरी बार इसको मैंने गुजरात में फिर से सेवन किया, कराया लोगों को। वो मैं कहने में संकोच कर रहा हूँ, वो मोहनलाल व्यास थे। मोहनलाल व्यास भी 80 बरस से ऊपर के थे और वो बहुत दिव्य संस्कार के आदमी थे। उन्होंने हमारा उनका ज्यादा परिचय हो गया था, तो उन्होंने कहा कि मिश्रा तुम कभी आर्सेनिक सेवन कराए हो किसी को? हमने कहा कि नहीं सर, हम तो नहीं कराए किसी को। हाँ, हमने कहा कि हाँ कराए हैं। तो कहा कि अरे यहाँ ठाकर और शुक्ला जैसे विद्वान पड़े हैं, सब हाथ उठा दिए कि नहीं हम नहीं कर सकते हैं, और तुम तो लौंडा आदमी, छोटा 30 बरस का हो और तुम अभी कह रहे हो कि ऐसा कर रहे हैं। तो फिर मैंने कहा कि साहब मैंने कराया है ना। तो उनको भी मैंने 30 दिन तक 40 दिन तक सेवन कराया, 1-1 लाइन खींचते रहे उनकी जेब में। और उनको हमने पूछा कि क्या लाभ हुआ आपको? कहा कि अब हमारे शरीर में बहुत स्फूर्ति आ गई है। तो इस तरह से मैंने 2 बार आर्सेनिक का सेवन लोगों को कराया जो कि 80 ऊपर के थे, 80 से ऊपर साल के थे। तो ये एक मेरा एक्सपीरियंस है। आप लोग भी यदि इसको चाहते हैं कि किसी व्यक्ति जो इच्छुक होगा, जिसको कि नई शक्ति उत्पन्न हो, ऐसे आदमी को आप सेवन करा सकते हैं। दूसरी बात है कि एक और मैं अपना एक्सपीरियंस बताऊं स्वर्ण भस्म बनाने के लिए। तो हमारे कॉलेज पटना आयुर्वेदिक कॉलेज में एक फार्मेसी नई खुली थी, स्टेट फार्मेसी, आयुर्वेदिक और यूनानी फार्मेसी ऐसा था। तो हम आयुर्वेद वाले में थे। तो हमारे गुरुजी को जो हजारी लाल शुक्ल नाम थे उनका, और वो बहुत बड़े रस शास्त्री थे, तो उनके संरक्षण में हम लोग दवाई बना रहे थे और बहुत कुछ सीखने का मौका मिल रहा था उनसे। तो कुछ दूसरे ग्रुप लोगों ने बैद्यनाथ को ये करके, मैंने बैद्यनाथ को अपने कब्जे में ले करके उनको मिनिस्टर से कहवाया कि एक दूसरा आदमी जो वैद्य है उसके संरक्षण में आयुर्वेदिक दवाई बने फार्मेसी में। तो हमको गुरुजी को बहुत तकलीफ हुई, तो कहा कि बेटा ऐसा है कि रोज की रिपोर्ट हमको बताना, देखते हैं ये लोग कैसे स्वर्ण भस्म बनाते हैं। तो ऐसा हुआ कि हमको 50 ग्राम स्वर्ण, उस समय गोल्ड बोर्ड था, और गोल्ड बोर्ड से हमको 50 ग्राम सोने का परमिशन मिला हुआ था। 10-10 ग्राम का एक स्टिक आता था। तो मैंने जो फार्मेसी मैनेजर थे उनको, उन्होंने कहा कि इसका पत्र बना करके ले आइए। मैंने कहा कि नहीं, मैं नहीं जाऊंगा, आप भी चलिए, क्योंकि मुझे ज्ञान नहीं है कैसे बनाएगा, क्या करेगा। सोनार तो पश्चातो हरा है, वो देखते देखते खा जाता है सोना। तो बहुत कहने पर वो भी चले। तो पत्र बनाया तो उसमें 5 ग्राम सोना कम गया। हम कहा कि देखिए, आप तो हमको कहते कि मैंने 5 ग्राम खा लिया। फिर बहुत हम लोग ने हल्ला हंगामा मचाया, तो मशीन खोल करके उसने निकाला, मशीन के अंदर वो 5 ग्राम सोना मिला। खैर, तो उसको वो जो नए अध्यापक आए थे उन्होंने उसको कैंची से पहले तो शुद्ध किया, तैले तक्रे गवाम मूत्रे आर नाले कुलत थजे में। फिर उसके बाद से उन्होंने उसको अपने अंगुली में लपेट करके खूब जोर से दबाया, और उसमें लोहे की तार, पतली तार में बांध करके तैले तक्रे दवा मूत्रे में इसको 7-7 बार बुझाया। उसके बाद कैंची से काटा, छोटा छोटा टुकड़ा किया, और पारा से इसको लगा करके रगड़ करके रख दिया। शाम हो गई थी, तो फिर हमने कहा, मैनेजर को कहा कि आप अपनी अलमारी में रखिए। उन्होंने कहा कि नहीं नहीं, सोना तेरे नाम पर है तो हम अपनी अलमारी में क्यों रखे, तुम अपनी अलमारी में रखो। तो खैर हम अपनी अलमारी में रखे। तो फिर मैं अपने गुरुजी के पास गया। तो गुरुजी की ने 2 दवाई सफेद पाउडर दिया, कहा कि इसको मिला दो और अच्छी तरह से मिला करके इसको छोड़ देना। तो मैं रात में गया और दरवान से चाबी ले करके, टॉर्च ले करके उसमें उसको मिलाया, और फिर पूरी तरह से मिल जाने के बाद फिर ताला बंद करके चाबी दे दिया। उसके बाद से सुबह में जब इन लोगों ने ये किया तो सूख गया था, तो चक्रिका बनाई छोटी छोटी, और उसके बाद से धूप में सुखा दिया, थोड़ी देर में सूख गया। 8 कंडों की अग्नि दिया उन्होंने, 2 शराब में बंद करके 8 कंडों की अग्नि दिया। तो ऐसा हुआ कि जब 1-2 घंटे 3 घंटे के बाद ठंडा हो गया, तो इन लोगों ने खोला उसको, तो सोना पिघल करके एक शराब से दूसरे शराब में आकर लग गया था, लाइन के जैसा। एक शराब से ऊपर दूसरे शराब में आकर के चिपक गया, और लकड़ी के जैसा हो गया सोना पिघल कर। तो उन्होंने कहा कि ये क्या हो गया। हम कहा कि मुझे क्या पता, मैं तो सीख रहा हूँ आप लोगों से। कहा कि ठीक। फिर अब उन्होंने पारा रगड़ करके उन्होंने ये किया। फिर उसके बाद से उन्होंने सब पूरा प्रोसेस नया किया, और उसके बाद से फिर उन्होंने टिकिया बना कर रख दिया, नहीं पेस्ट बना करके रखा। तो मैं गुरुजी के पास गया और पूछा, उन्होंने कहा कि ये 2 दवाई ले जा करके आज मिला दो। हमने कहा ये क्या मिलाया, कल क्या मिलाया था, आज क्या मिलाया? तो बता देंगे बाद में। हम नहीं बताता कोई नहीं है, आप बताइए आप क्या मिलाया था कल और आज क्या मिलाया है। तो उन्होंने कहा कि पोटासियम नाइट्रेट कल मिलाया था और आज सुहागा टंकण मिला रहा हूँ, और एक और भी द्रव्य है, क्षार है, जवक क्षार जैसा कहा कि हमने खुद बनाया है, जवक क्षार है। दोनों को मिला करके मैंने उसको फिर रगड़ दिया। दूसरे दिन फिर वो लोग आए और फिर चक्रिका बना करके उसको उन्होंने फिर संपुट किया और 8 कंडों की अग्नि में ये किया। जब 2-3 घंटे के बाद ठंडा होने के बाद जब उन्होंने खोला उसको, तो कहीं सोना था ही नहीं, दोनों शराब में कहीं भी सोना नहीं था। तो वो बहुत दुखी हुए, कहा कि यहाँ तो प्रेत रहता है। हम कहा कि मुझे क्या मालूम है सर, आपके सामने ही आपने टिकिया बनाया है, हमें क्या पता है। खैर, तो वो छोड़ करके भाग गए। फिर हमारे गुरुजी को ही गवर्नमेंट ने किया कि आप इनको ये करिए। तो ये 2 एक्सपीरियंस देखा। तो उन्होंने कहा कि ये 2 जो शराब है दोनों को रखे रहना, सोना उसी में घुस गया है। तो मैंने उस दोनों को फिर सुरक्षित रख लिया और गुरुजी को 2-3 दिन के बाद फिर ऑर्डर जब आ गया तो गुरुजी ने उसको पाउडर किया और जितना सोना था उतना ही 50 ग्राम उसमें पारा डाल करके रगड़ दिया। तो मिट्टी अलग हो गई और पारा और सोना का 100 ग्राम का अलग एमालगम बन गया। तो फिर उसके बाद से उन्होंने ऊर्ध्वपातन करके पारा प्राप्त किया है और ये सब किया। तो 2 एक्सपीरियंस हमको उनसे सीखने का मिला, जो कि बहुत अनुभव लोग नहीं जानता है। और वो इस तरह के करिश्मा करते थे, उसमें इस तरह का वो उनका अनुभव था कि एकदम जादूगर जैसा और रस शास्त्र के काम करते थे। तो ये 2 एक्सपीरियंस है, आप लोगों को भी मैं इसके बता रहा हूँ कि आप लोगों को भी किसी को हंट करना है, किसी को परेशान करना है कि जो नया आपको आकर के आपके कार्य में विघ्न डालता है, उसके लिए आप ऐसी शिक्षा से आप उनको प्रभावित कर सकते हैं। तो ये 2 मेरा एक्सपीरियंस था, ये 2 मेरा एक्सपीरियंस था, इसलिए मैं आपके साथ ये सम्मिलित करता हूँ इसको। और बताइए आप लोग कुछ यदि इस संबंध में पूछना चाहते हैं तो फिर आप अपनी प्रक्रिया बोलिए। आप गोपी कृष्ण,
Anyone want to ask anything regarding the science, regarding Rasa Shastra? You can unmute yourself and ask Mishra sir. He is happy to answer your questions. सर सबसे इम्पोर्टेंट ये है कि सर लोगों का ये मानना है कि कितना दिन हम रसौषधि एक साथ ले सकते हैं। क्या है इसको 1 महीना लेकर बाद में कुछ ब्रेक देना है या बहुत दिन कंटिन्यू में ले सकते हैं या इससे कुछ टॉक्सिसिटी हो जाएगा, क्या है? लोगों में रसशास्त्र का एक भय एक बैठता है, हेवी मेटल टॉक्सिसिटी पढ़ लेते लोग पब्लिकेशंस में, तो उसी को इम्प्लाई करते हैं रसौषधि का हमारा शास्त्र के साथ। तो आपका इरादा क्या है सर, कितना दिन हम रसौषधि ले सकते हैं?
ऐसा है कि ताम्र भस्म बनाने की जो पद्धति है ना,
हाँ सर,
उसमें मेरा अनुभव है कि कई बार पुट देने के बाद भी ताम्र भस्म में जो उसका विषैला प्रभाव है वो रह ही जाता है। तो उसके लिए मैंने एक पद्धति निकाली है कि लास्ट में कई बार अग्नि संस्कार देने के बाद भी उसमें वोमिटिंग टेंडेंसी रह जाती है। तो इसलिए मैं अब क्या, मेरा अनुभव है कि गंधक के साथ लघुपुट देना चाहिए। तो लघुपुट देने से ये मतलब होता है कि एक कण, ताम्र का एक कण में दोनों तरफ से 2 कण ताम्र में चिपक जाते हैं। तो जो ताम्र में चिपक जाएंगे 2 तरफ से 2 कण गंधक के, तो हार्मफुल नहीं होगा, वो वोमिटिंग टेंडेंसी नहीं करेगा। तो मैं ये समझता हूँ कि अंतिम समय में ताम्र भस्म को लघुपुट दे करके, ताम्र के साथ गंधक के साथ लघुपुट दे करके इसका प्रयोग करना चाहिए। ये मेरा अनुभव है।
सर, किसी में आपने रसौषधि दिया जिसको कुछ कॉम्प्लिकेशंस आए सर?
नहीं सर, रसौषधि, इसमें रसौषधि की ताम्र भस्म,
रसौषधि सर, जो भी रसौषधि आपने दिया, कुछ प्रॉब्लम हुआ किसी में?
नहीं, इस ताम्र भस्म का कोई साइड इफेक्ट नहीं हुआ। और कई बार मैंने प्रयोग किया है, लेकिन रसौषधि का कोई प्रयोग में कोई नुकसान तो दिखाई नहीं दिया।
यस सर।
लेकिन ये अफवाह है, डॉक्टरों के तरफ से फैलाया जाता है कि पारा का उपयोग हमारे लिए शरीर के लिए नुकसान है। लेकिन जब गंधक के साथ पारा का उपयोग करते हैं, जैसे खास करके उसमें रस कर्पूर और रस कर्पूर और रस और है ना एक
रसपुष्प।
पुष्प। हाँ, तो इसमें कुछ संदेह हो सकता है, लेकिन जब गंधक के साथ पारा है तो कोई उसका साइड इफेक्ट हमने नहीं देखा। और बहुत बार प्रयोग किया है, और बहुत अभी भी चिकित्सा में करता हूँ। लोग आते हैं गांव से रोगी, और उनको रसौषधियों का प्रयोग करता हूँ, तो उसमें काफी लाभ मिलता है। और दूसरी बात है कि जैसे खास करके आजकल के जॉइंट्स पेन है, घुटने का दर्द के लिए लोग आते हैं ज्यादातर, तो उसमें मैं 4 गोली योगराज गुगलू और 2 गोली बिस्तिंदुक बट्टी 3 टाइम देता हूं, तो उससे उनको लाभ होता है। 4 गोली मतलब 12 गोली दिन भर में 3 बार, और 6 गोली बिस्तिंदुक बट्टी, इसका प्रयोग होने पर लाभ करता है। और जामनगर का जो रिसर्च था 1952 से लेकर के 60 तक, उसमें मैं भी वहाँ था। तो पुनर्नवादी मंडूर पर रिसर्च हुआ था। तो मॉडर्न टीम और आयुर्वेदिक टीम दोनों काम करती थी। 2 MRCP डॉक्टर लोग थे, और 2 रामरक्ष पाठक और 2-3 रामेश्वर शर्मा, इलाहाबाद के 2 बड़े बड़े प्रमुख वैद्य भी थे। और छोटे छोटे कई थे, ध्यानी, ज्ञानेश्वर पांडे और ब्रह्मदत्त शर्मा, ये सब तो छोटे छोटे थे। लेकिन फिर भी इनका सक्सेसफुल प्रयोग ये हुआ कि इन लोगों का रिजल्ट आया। एक जामनगर का बुक आता है, मिलता होगा अभी भी, उसमें था कि पर वीक 1 ग्राम हीमोग्लोबिन बढ़ाता है पुनर्नवादी मंडूर। तो पुनर्नवादी मंडूर के लिए भी बहुत अच्छा एक रिजल्ट है, और उसका भी लोगों को पुनर्नवादी मंडूर का प्रयोग करना चाहिए।
सर, आपका स्वास्थ्य का राज क्या है सर? आपका स्वास्थ्य का
अरे
राज?
कहाँ मैं स्वस्थ हूँ, मैं कहाँ स्वस्थ हूँ। मैं तो देखो डायबिटीज आज 40 वर्ष से हूँ।
नहीं सर, 96
लेकिन
इयर्स में हमारा 2 जन्म हो जाते हैं आजकल की
मैं
क्योंकि
40 वर्षों से डायबिटिक हूँ,
जी
तो
सर।
स्वस्थ तो नहीं हूँ, लेकिन हाँ फिर भी अच्छा, मैं परहेज कुछ नहीं करता।
जी जी जी। हाँ।
अच्छा, मैं सब कुछ खाता हूँ, मीठा भी खाता हूँ, मिठाई भी कभी कभी खा लेता हूँ। लेकिन हम सोचते हैं कि हमारा डायबिटिक इस तरह से नहीं, क्योंकि हमारे घर में डायबिटिक नहीं था, माता पिता को नहीं था। कोई और भी आगे के लोगों को नहीं था, लेकिन हमारे 2 भाइयों को हो गया था। तो लेकिन मैं, वो लोग परहेज करते थे, मैं बहुत परहेज नहीं करता हूँ, खाते रहता हूँ। तो अब तो जो भी इसमें है स्वास्थ्य का ठीक हूँ, चलता फिरता हूँ, और मुझे अभी तक कोई घुटने में दर्द वगैरह नहीं है। एक तो हमारा शरीर हल्का फुल्का है, ज्यादा से ज्यादा इस समय 56 किलो का वेट है हमारे शरीर में। तो ये भी कम ओवर वेट जो इसको होता है, उसको तो परेशानी घुटने की होती ही है, सभी जगह सब जगह होता है। तो और उसमें भी 60 वर्ष के बाद लोगों को ज्यादा होता है। तो वेट घटाने का प्रयास करते रहना चाहिए, ज्यादा ओवरवेट नहीं होना चाहिए, इसलिए स्वास्थ्य ठीक रहता है।
तो थैंक यू सर, बहुत अच्छा रहा आपसे मिलने के बाद, और आपका आशीर्वाद तो खूब चाहिए। हमारा ये जो 1 साल का हुआ तो और आगे इसको ले जाना चाहते हैं।
आशीर्वाद हमारा आपके साथ है, ठीक रहा। कैसा मेरा ये रहा, जो भाषण रहा वो कैसा है आप लोगों को लगा, तो ये सब तो आप लोग समझ रहे होंगे। मुझे तो बोलना था, मैंने बोल दिया। तो
सर आपका हर अक्षर हमारे लिए आशीर्वाद है सर। आप काटेंगे तो भी आशीर्वाद ही है हमारे।
हाँ,
तो आज
ठीक है, आशीर्वाद।
एक दाना चावल लेते नहीं तो रोटी खाते, तो उसका सिग्नेचर आपके ऊपर ही है, क्योंकि आपने हमको ज्ञान दिया तो हम खा पा रहे। तो आज हम ये नमूने से है आयुर्वेद की फील्ड में, तो आपके वजह से है।
चलो
मिश्रा
ठीक
जी,
है।
मिश्रा जी बहुत खुश है आपको मिलने से। शीला रानी चुंकत चेन्नई से बात कर रही हूँ। शीला रानी चुंकत चेन्नई से बात कर रही हूँ।
हाँ हाँ,
बहुत खुश है आपको हमने बेलारी में मिला। तभी हमने BAMS शुरू किया था रिटायरमेंट के बाद, आपको मिला था वहाँ। तो बहुत खुश है हम।
हाँ हाँ,
BAMS हमने अभी कंप्लीट कर दिया।
चलो आपने कोर्स पूरा कर लिया ना?
हाँ, पूरा कर लिया।
और फर्स्ट पे है सर।
आप तो MBBS के बाद किया था कुछ?
नहीं सर, IAS के बाद। IAS के बाद।
अच्छा, IAS के बाद, हाँ सॉरी। हाँ, IAS के बाद आपने किया था शुरू आयुर्वेद
जी।
मुझे याद है, आपका पूरा चेहरा सामने आ रहा है। तो मैडम, तो बहुत अच्छा लगा आप भी हैं इस मीट में। ये
आप तो हमारा बहुत इंस्पिरेशन है। आपने इतना किया राष्ट्रशास्त्र के बारे में। आपका पुस्तक सब पढ़ने का इरादा है, लेकिन अभी बैठ के पढ़ना है। अभी वो परीक्षा सब कर रहे थे लास्ट ईयर तक। अभी वो सब पुस्तक हमने खरीद के रखा है, तो वो अभी पढ़ेंगे। और 96 इयर्स में आपके जैसा होना है हम सब।
आप मुझसे भी अच्छा होइए, यही मेरा आशीर्वाद है।
थैंक यू जी।
अच्छा, ऐसा था कि मैंने रसशास्त्र के बारे में जितनी पुस्तकें हमको ज्ञान में आया, सबने उन पुस्तकों का ट्रांसलेशन किया, और सभी लोगों ने उसको, जो किसी भी रसशास्त्र के बारे में ज्ञान नहीं था उन पुस्तकों के लिए, वैसे ऐसे सभी पुस्तकों को मैंने अपने ये में अनुवाद करके सार्वजनिक किया है। तो अब तो कोई रसशास्त्र, अभी नागार्जुन कर रहा हूँ मैं।
बहुत ह्यूमन सर्विस कर रहे हैं आप।
हाँ, लेकिन देखिए, नागार्जुन मेरे पास संपूर्णानंद संस्कृत यूनिवर्सिटी वाराणसी का छपा हुआ त्रुटिपूर्ण है, बीच बीच में बहुत सारे श्लोक है। अब चौखंबा वालों ने कहा है कि मेरे पास 400 पेज का नागार्जुन एक प्रति आई है, और वो बिल्कुल सॉलिड है, उसमें कुछ ये नहीं है, त्रुटि नहीं है, आप उसको कर दीजिए। तो मैंने उनसे मांगा है, तो कहा है कि ठीक है, मैं भेजता हूँ आपको, और उसी को करिए।
ठीक है
तो एक अच्छी
जी,
किताब हो जाएगी नागार्जुन की।
नागार्जुन की। अच्छा जी, IIAR के वजह से हम स्टडी सेशंस करेंगे आपका पुस्तक सब।
जी सर।
गोपी कृष्णा जी, वो कर सकते हैं हम?
हाँ बिल्कुल मैडम, वी विल डू इट।
We can have study sessions of sir's books.
Yes, 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 yes. No, madam. Every part which we are discussing is the inspiration and the teachings of Sir's book only.
Sir's book only.
It's a copy-paste version. Everything is a blessings of Sir.
हमारी रसशास्त्र,
हाँ,
हमारी किताब रसशास्त्र का, आयुर्वेदीय रसशास्त्र का इंग्लिश ट्रांसलेशन करना चाहता है प्रकाशक, लेकिन कोई मिलता ही नहीं है कि इसको इंग्लिश ट्रांसलेशन करे, किसी के पास टाइम नहीं है।
हम ट्राई करेंगे। अभी तो एग्जाम सब खत्म हो गया। अभी एक पुस्तक लेके हम इंग्लिश ट्रांसलेशन कर सकते हैं, करने के लिए ट्राई करेंगे,
कोशिश करेंगे।
हाँ हाँ हाँ। तो ठीक है मैडम, आप यदि कर सकती हैं तो मैं उनको बताऊंगा, आपसे संपर्क करेंगे।
अच्छा जी,
जी
आपका आशीर्वाद से कर सकते हैं।
हाँ,
मेरा आशीर्वाद तो पुस्तक ही है, तो मेरे आशीर्वाद की अब जरूरत नहीं है। लेकिन यदि कहीं और कोई रहेगा उसमें प्रॉब्लम, तो फिर मैं तो हूँ अभी, यदि जीवित हूँ तब तक तो ठीक ही है। चलिए, बहुत बहुत अच्छा लगा है आप लोगों के साथ ये वीडियो कॉल करके आप लोगों से संपर्क हुआ।
yes sir.
नया याददाश्त रहा।
Thank you sir. बहुत अच्छा हुआ आपसे मिलने के बाद और आपका आशीर्वाद लेने से। तो thank you very much sir.
Thank you so much sir.
Thank you sir.
थैंक यू।
Thank you.
yes. Thank you so much, sir. We studied his book unknowingly that it is sir, and when we met him, it is a privilege for us because it is a like Bhagavad Gita for us while we were studying in our BMS studies. Just our seniors, our super seniors, everybody would mention, you read Mishra sir book, you will definitely pass, you will get distinction, not to worry. So, and we pass that, and it is a overwhelming situation for us that we are a part of the institute where sir is blessing us to continue with the sessions. To continue with the session, it is the time to gain knowledge from our keynote speakers. I request Dr. Nagaveni to introduce Dr. Ramdas Manati sir.
Thank you so much, ma'am. And it is a great privilege for me to introduce our guest today, Dr. Ramadas Magatti sir. Presently, sir is the principal and medical superintendent and head of the Department of Kaya Chikitsa at Sri Dhanvantari Ayurveda College and Hospital, Chandigarh. Sir is an alumni at NTR University of Health Sciences, Vijayawada, AP for his PG post-graduation studies, and holds PhD from SCSBMB, Kanchipuram. With a long professional experience of 32 years, Sir has treated approximately more than 1 lakh patients. Sir is the chairperson and resource person at many national and international conferences and reorientation programs. Sir has organized many national and international seminars. To name a few, Sir has organized national level workshop on skin diseases, a cancer care in Ayurveda, workshop on preparation of Paratalinga without fire, and also has organized a workshop on clinical practice, the preparation of Rasashastra, and a national level workshop on Nadi Pariksha and national level conference on Mani, Mantra, and Aushadha in 2018. We welcome you, sir, to our sessions.
Good morning to one and all. Am I audible?
Yes sir.
Yes,
Yes,
sir,
sir.
you are audible.
I have to go back to approximately 6 to 7 years. That first I have met Dr. Gopi Krishna at Vijayawada in some conference. He spoke on cancer therapy in Ayurveda with Rasashastra. Dr. Gopi Krishna, probably I'm right.
Yes, sir. Yes, sir.
Yeah, the moment when I saw he is a genuine worker and did a lot of work in cancer and with Rasashastra, I'm very much impressed. And the next moment I thought, because I have a great responsibility on my shoulders, that I have admitted Dr. Sheila Rani Chunkat Madam, a retired IAS officer in a normal Ayurvedic college, whose expectations will be very high, but to studying second year. So then I'm in search of people in the relevant fields to offer them good knowledge. So the moment when I came to college and I said, okay, I have found one good experienced person in Rasashastra. Why can't we have a workshop? And the moment it has been organized, and probably myself also have joined for 4 or 5 days at Ballari. It's a mega event, and we understood things are really happening, and practically people can learn. That is our first interaction. And probably the interaction has continued up to COVID, and every year from our college students used to come and they used to learn. And even I told very clearly teachers that every year when you are going, you have to learn one new thing and you have to come back, and the same thing has to be offered to the students. So it has successfully happened. And in between all of us, we are aware that due to COVID, instead of physical appearances, we have switched over to online. And yes, certainly online education has taught us, especially Ayurvedic people, great avenues that instead of meeting public in person, it's very easy that so many experienced, renowned Ayurvedic doctors we could meet in this 2 years of time in the way of so many webinars. And even students have much more access when compared to conducting physical workshops and seminars. So, and I'm extremely fortunate to hear Siddhanandan Misraji. Like all of you, I am also a big fan of Siddhanandan Misraji. I have studied Rasashastra book when I was a student, and today, first time I am seeing directly through online. Namaskaram, sir. Namaskar, Siddhanandan Misraji. And similarly, I congratulate Dr. Gopi Krishna for his online program, Indian Institute of Ayurvedic Rasashastra. Probably I am an odd man out in this particular thing, because situations have compelled me to become, to practice more with kashayas and tailas. So when I have started my practice, but anyhow, I understood that they are not, with that also we can do miracles. And when he asked me to speak at random about the clinical experiences, I opted to take the topic low back disorders. Why I have chosen this particular topic is because nowadays students are entering into Ayurvedic course with an expectation that they expect livelihood, because the moment when they're entering into +2, they are searching for options, which type of course they have to select, with which course their future prospects, their earnings will be good. So then in our system also, we have to find out various areas where there is a lot of potential that the students will have a decent livelihood. So with this idea, today I have taken the topic of low back disorders, which is my favorite for the last 22 years. Thousands of patients I have treated, and I have avoided surgeries, mostly without going into much technical details. Whatever work I did, I wanted to present today. So once again, I invite all the speakers and the guest speakers of this Indian Institute of Ayurveda Rasashastra who spoke on this platform. Similarly, students who have joined on Facebook. Now we will go into the topic. So most of my work, I worked in Sri Jayendra Saraswati Ayurveda College, a unit of Sri Chandrasekharendra Saraswati Vishwamahavidyalaya, which is established by Sri Kanchikamakoti Peetam. These are all great seats of 19th and 20th century, especially Sri Chandrasekharendra Saraswati, living God, by saying pranams to these great acharyas. Today I am going to start my lecture. Scope of this lecture: scope of Ayurveda in various spinal disorders, strengths and weaknesses in modern medicine and Ayurveda in spinal disorders, economic potential of Ayurveda, limitations and appropriate time to refer. So when we see the graph, the low back pain takes the major ratio of people suffering from the disease. When next is depression, iron deficiency, HIV, like that. This is low back pain prevalence map. Throughout world, everywhere it is there. A minimum of 5,000 cases per lakh to a maximum of 13,000 cases per lakh. So this is about various types of spine disorders, especially West Pacific region and Southeast Asian region are more prevalent, and in this area, more people are suffering from low backache. Around the minimum 2,450 people to a maximum of 4,250 people per lakh at different places, people are suffering from back pain. This is the leading cause of maximum number of holidays at work. And similarly, the cost impact around only for the medications, and it comes around 2,000 pounds, and altogether investigations, add-on surgery, rehabilitation measures, it goes up to 12,000 pounds. You can imagine per person, if this is the cost, and with such a large magnitude, what will be it is in around 4 to 5 billion dollars per annum. This is the cost of this particular problem. Age-wise prevalence, this is somewhere in between 25 to almost 60 to 64 years, 60 to 64 years. The problem is very, very prevalent. This is the data in between 1990 and 2015. Most important, the cost of this particular disease can be divided into inpatient care, outpatient care, and last days of work. If we see in 2012, the inpatient care will be 6,4,65,832. The same has gone to 27 crores 99 lakhs 11,684. This is, and similarly outpatient care, it is in 2012 10 crore 51 lakhs 92,394 US dollars. Somewhere in 2000 it is somewhere 46 crores 29 lakhs 63,000 odd. Similarly, the cost is last days of work in US dollars. It is around 46 crores 7 lakhs 31,529, which has gone up to in 2016 478 crores 7 lakhs, no, sorry, 47 crores 80 lakhs 73,190. That much of escalation is there. In the current scenario, probably it is very high. So brief anatomy of the spinal cord, we need not go much details. This, here we are seeing the curvature. This is very, very important. This is God's gift for us. Because of our abnormal sitting postures, working postures, this curvature is going to change. When we see majority of the MRIs, usually here there should be some amount of lumbar lordosis. It will increase during pregnancy much more. But this lordosis will go away, and in majority of the cases, it becomes straight MRI. This is also one reason majority of the people are suffering from low backache. Similarly, the curvatures are very, very important. So all of us, we know the spinal cord, especially the continuation of medulla oblongata, conus medullaris, then especially tapered into finum terminal, and after that, the spinal cord is continued a bunch of nerves, that is cauda equina. Especially this space is very, very important. Below L3, somewhere, if compression is taking place, it is en masse compressing the cauda equina. There is called cauda equina syndrome, where there will be involvement of bowel, bladder, as well as loss of function of lower limbs. All of us, we are aware of the cross section of the spinal cord. So this is anterior roots and posterior roots, and it has a gray matter and white matter, dorsal and ventral roots and ventral anterior. So these are all 32 pairs of spinal nerves, 8 pairs of cervical, 12 pairs of thoracic, 5 pairs of lumbar, 5 pairs of sacral, 1 pair of coccygeal nerve. Dorsal root, and similarly ventral root. C1 to C4 cervical plexus, C5 to T1 brachial plexus, T1 to L5 lumbar plexus, L4 to S3 sacral plexus, and S4 to S5 coccygeal plexus. Now I am going into straight away into the problems. What are all the common problems we are going to receive in day-to-day practice? And I have started somewhere my practice, of course, long back. For the first time, 1999, Chennai, I have received a patient named Chamundeshwari, who was brought on hands. Those were the early days that, especially in corporate hospitals, spinal surgeries are taking place. And she has been asked for a surgery, and they are not interested to undergo surgery. So that was my first case. I said, okay, I will try with Ayurvedic medications and treatments. Suppose if I can treat, because first time such type of case I'm handling, almost it is 22 years before, then they have also accepted if I fail, then certainly you have to go for an operation. First time, after treating her for 21 days, she was successfully able to walk. That has given me a strength. Okay, this is the area where we can go and we can venture further. And from that period, because one after the other, number of cases I used to receive, I started treating, and whenever every new situation, and I observed that in every case I'm getting result, which has been verified number of times, and that has been even successfully transformed to few of my students, and even students who have worked with me, they are also successfully practicing. So among the various types of low back pain and causes, sacralization, that is partial sacralization and complete sacralization, people suffer from severe low backache. Even I have an example of one of my student who cannot sit in classroom. After treating him, anyhow, I'm going to discuss, especially you can see here, certain times this L5 vertebra will fuse, this is on one side, certain times it will fuse on both sides. So that is called complete sacralization of L5 with S1. But treating with our drugs, people are getting successful treatment. This is, we can see here, this side, it is clear. This side, it has been fused. Certain times it creates only problem in the low back, certain times maybe compression of the narrow root and pain may extend down. So these are the common problems. Second one is spinal stenosis. So this is primary stenosis as well as secondary stenosis. This is secondary stenosis, where the disc will move forward. It straight away compresses the spinal cord, as well as, depending on posterolateral, right or left, even it compresses the narrow roots. So this is the commonest problem we'll come across. Especially in MRI, we can see like this. So even I have received cases where multiple disc prolapse, more than 5, 6. Initial days, doctors, they are reluctant to operate because even one disc means they try to venture. I remember one patient, of course, I don't want to reveal her name. Around 8 places there was severe disc prolapse, and doctors are reluctant because, okay, they will cut one disc, but every time they cannot cut. Her situation was so difficult that when she cannot sit, she cannot walk, mostly she has to lie down in the bed. So such type of patient also we have treated. This is only at one place. This is foramina stenosis. This is lateral stenosis, this is central stenosis, and this is foraminal stenosis. Frequently we receive these type of cases. And in MRI we can see here spaces are good. Here the spaces are narrowed. The nerve will be compressed. Patient will have severe pain. Depending on the level, the expression of symptoms will be there. Spondylolisthesis, these are degenerative changes of the spine. So the spondylosis can occur at cervical level as well as lumbar level. That is bulging of disc, bony spurs, and narrowed disc spaces. You can see actually whatever picture I have kept here is a very simple one. We can see that more or less all vertebrae will be fused with osteophytes. Here we can see the growing osteophytes. Usually these will compress the nerve roots, and ultimately patient will develop pain. So this is one more condition, spondylolisthesis. Grade 1, grade 2, grade 3, grade 4. This is a normal thing. All of us, we can see all vertebrae with intervertebral discs in alignment. Here also they are in alignment. Whereas here we can see there is slight drooping of the upper vertebra and the lower vertebra. This spondylolisthesis may be single listhesis, maybe double listhesis, maybe triple listhesis. More common in lumbar area and less common in cervical area. But in the cervical area also, I have seen few cases of spondylolisthesis. So in this, you see the grade 4. I have received up to cases grade 3, which have been sent repeatedly for operation, but successfully I could manage. This is spondylolisthesis grade 2, not grade 3. Even if it comes up to here, this becomes grade 3. So all of you aware of intervertebral disc collapse. So either this side or this side, certain times on both sides, it compresses the nerve root and creates severe pain. Depending on the level, there will be expression of symptoms. So here we are seeing in MRI. So this side, the nerve root is passing. There is no good amount of spaces there. This side, the space is minimal and compressing the nerve root. Okay. And one more thing is, especially here, certain of the conditions later I'll discuss. People fall, they fell down in sitting position majority of the times, usually because of slip. Straight away in a sitting position, they will fall, and at that time the affected part will be coccyx. There will be severe coccygeal pain. These people will have a great difficulty in sitting in hard surfaces. They will be given a cushion, a round cushion, so that the coccyx will not touch. In central, there will be a hollow space that coccyx will not, and especially majority of the people, they will have a great difficulty in sitting, that which I have not brought here. That is coccygeal pain and injury to coccyx. And like that, several other conditions also. And in my experience, apart from the textual thing, what I have seen is pain, burning, numbness, weakness, loss of function, emaciation of muscles, difficulty in walking, foot drop, and loss of bowel and bladder control. With spinal disorders at lower level, these are the symptoms. Suppose at cervical level, quadriplegia, at lumbar level or thoracic level, there will be paraplegia or paraparesis. When patients, when they are coming to us, they express different types of symptoms which we can see and we can observe, and we will get in our day-to-day practice. Certain people will come with the difficulty in standing, difficulty in sitting, difficulty in bending, difficulty in lying down, difficulty in turning in bed, difficulty in lying in ventral position, pain in the low back only. So these are various These are the typical presentations we will receive. Because I am telling whatever I have experienced, whatever I have seen in these years, only I am telling. Similarly, pain in the low back radiating to either one leg or both legs, pain in the anterior aspect of the lateral aspect or peroneal of the leg or peroneal area, pain in the foot anterior aspect, pain in the posterior aspect of the entire thigh. This is the way presentations will come. And most important, the backache mechanic, the primary or secondary, usually the secondary, abdominal diseases also will create radiating problem. The abdominal, so many abdominal problems will create backache, acid erectations, burning sensation in stomach, heaviness in stomach, indigestion, slow digestion, abnormal vaginal discharges, gas in the abdomen, constipation, history of constipation, diarrhea, dysentery, chronic cystitis, prostatitis. These are all to be taken into consideration when you are going to treat low backache. Very, very important. One example I wanted to give, especially a patient, two cases, patient suffering from severe gastritis. She has received treatments at different places, but majority of the occasions, they have tried to treat her with only low back medicines and all treatments related to low backache, all external procedures. But more than 4 or 5 years, she is basically a teacher from Ramanathapuram. And they have not attended her severe gastritis. A peculiar symptom, what she said is, wherever in her body, if you pinch, the next moment she will have an acid erectation. Probably people who are in the field, we will receive such type of cases. And in that particular case, I have treated initially gastritis, and then I have started treating her for low backache. Even today, I am following her, and she's absolutely free from her low backache. Like that, several patients I have come across. So we should not simultaneously, when we are treating a low backache patient, we have to take care of the add-on complaints, and add-on complaints are to be parallelly treated. Then only we will get successful treatment results. Otherwise, we will end in failure. This is one example. Like that, so many other conditions. And one more point I wanted, why we have to take care of these associated complaints. People who are suffering from chronic constipation, chronic gastritis, chronic vaginal discharges, cystitis, certainly their back will be frequently eroded. Means they will develop degenerative disorders so easily on spine. So that is the reason treating the abdominal situations is very, very important at the early stage. Ultimately, they become true mechanical problems of spine also. This I have observed. Even in cervical region, people who are chronic sufferers of sinusitis, they badly suffer from chronic cervical issues and degenerative changes. These are my observations. Then when people are coming for low backache, how the different presentations? People come to our clinic with a normal walk, telling that they are suffering from a low backache, a moderate pain, severe pain, still they walk and they will come to our clinic. Severe pain with limping, bending on either side. Severe pain, able to walk with the help of bystander or on wheelchair. Brought on hands or stretcher. In this way, people will visit our clinics. These are the 6th one, brought on hands and stretcher, are extreme cases. So other than true low back disorder, there are certain other associated conditions which may mimic like low back disorder, true low back disorder like piriformis syndrome, sacroiliitis, avascular necrosis hip, ankylosing spondylitis, TB spine, seropositive and negative arthritis, CS spinal vertebral bodies, intramedullary and extramedullary lesions. Why I am specifically mentioning this? Because it is not only I am treating patients in ward, simultaneously I am observing other physicians who are treating the patients. And what are usually common mistakes, the possibility of mistakes. I have seen one time that a patient came with avascular necrosis hip, but he could not tell properly what his problem exactly, where it is happening. But the patient has been given treatment for low backache. I am following in the ward, and ultimately he did not get any improvement. So especially these are the problems to be kept in mind when we are attending low back patients. Especially spine is a place, true degenerative problems, mechanical problems, and apart from that, ankylosing spondylitis, seronegative, seropositive also can create low back ache. So that is the reason our Amavastha and investigations do play a major role in identifying whether it is a pure degenerative or pure mechanical problem of the spine, or is there any association of Amavastha or any Ama disorder associated with low back pain. Very, very important. Otherwise, we will start applying oil. Ultimately, it will end up in a failure. Very, very important. Apart from that, TB spine, because I have received casually as like a low back disorder, few cases of TB spine, intramedullary tumors, extramedullary tumors, and CS spine also. Especially CS spine, secondaries from abdominal origin, silent. But initial manifestation is low backache. When we have verified, we understood that people are suffering from CS spine. So how do we come to a conclusion that the patient is suffering from CS spine? We start treating the patient. Certain times, without investigations, people will come to us. We know the burden of the investigations are so huge. We know that anyhow, we are very confident about the treatments. When we start treatment, after 1 week, after 10 days, the patient is not responding and the condition, his clinical condition is deteriorating. Understood that the problem you are treating is not the true backache, maybe something else. Certainly we have to go for investigation. In such a way only I have understood this TB spine and the CA cancer vertebral bodies. Certain times people will come straight away with investigations. It will be easy for us to judge the things. Because majority of the occasions, people won't come with investigation, straight away they will come. Then, certainly these investigations are mandatory, because if you don't want to have a failure, we have to go through these investigations, at least in the beginning or middle of the treatment. Especially complete blood count will give us a clue for any patient is suffering from any infections. There's RA, CRP, ASO, uric acid, any of the rheumatological problems patient is suffering from. X-ray, we can find out degenerative changes, the disc prolapse and the listhesis, we can find out very clearly. CT spine, furthermore, we can understand the situation of the disc, understand any fractures are there, lamina fracture, foramina stenosis, all these things. MRI spine will teach us the compression of narrow roots and is there any compression of spinal theca, whether there is any flow within the cerebrospinal fluid, movement is there, not. All these things can be identified in more detail. And especially CT spine, we can identify the tubercular cavities and other things. Bone mineral density test. One more, osteoporosis, probably I have not mentioned in the frequently receiving problems. This bone mineral density will clearly understand the state of the spine and how far the people may prone for vertebral fractures. If they are beyond red zone, certainly there is a possibility of their bones are very fragile and they may suffer from vertebral fractures. I have received so many osteoporotic vertebral compressive fractures with people lying down in bed. We have a successful treatment. Similarly, certain times the presentations are weakness in lower limbs, foot drop. At that time, whether it is because of low back problem or otherwise any neuropathies, at that time nerve conduction studies are very, very important. PET scan to identify the cancer spine as well as anywhere either primary or secondaries are there in entire body, cancer situations are there. These are very, very important. The new generation should learn, otherwise somewhere we are going to err. So what are the Ayurvedic descriptions available? Gridrasi told in Vatavyadi Chikitsa, Gridrasi told in Nanatmaja Vyadi. This is Kevalavata, Katigraha, Prushtagraha, Grivagraha, Manyastamba. These are some Ayurvedic descriptions about spinal disorders. So there are spinal disorders and more or less related conditions told on spine: Padasula, Padabhramsa, Padasuktata, Vatakuddata, Gridrasi, Ursada, Pangulya, Shrodibedha, Kanjatva, Kubjatva, Trikagraha, Prushtagraha, Bahusosha, Grivastamba, Manyastamba. These are all spinal disorders. Available descriptions in Ayurveda. All of you are aware, for any of these things, including degenerative disorders, mechanical backaches, whatever common Nidana told in Vatavyadi, the same will imply, and we can see in our practice. So people, especially the red marked visualists, people who are going to do Ratri Jagarana. Nowadays we see in majority of the industries and software, we have round the clock shifts. People are waking up during night hours, which is going to aggravate Vata constantly. But for that, we are not taking any compensatory measures. Over a period of time, that will culminate into degenerative disorders. This is a very common problem we are seeing. So there are excessive movements such as leaping, jumping, wayfaring, and physical exercise. Nowadays, people are going for gym, people are walking in excess, 45 minutes walk, 1 hour walk, morning walk, evening walk, going for gym, doing various type of stretches for 45 minutes, 1 hour, lifting heavy weights. All of you know the theory that Vyayamam Ardhasahityam, that Ardhasahityam, they have clearly gave the definition that once when you develop a simple sweating on your forehead, on the chest, and when you have a slight dyspnea, that is difficulty in breathing, exertional because of exertion, that is the time to stop. But none of us, we are following all modern methods, and probably this is also one added cause for people suffering from various spinal disorders. This is added cause which has to be, we have to take a survey. we have to take a survey. Certainly, this will be an add-on cost with so much of money spending on attending gym and other things, people suffering from low backache. So all of us, we are aware, anger, fear, day sleep, suppression of urges, amadosha, injury to vital parts, falling from elephants, horses, even though nowadays elephants, horses, but we know that in so many sports, people are falling down, sports events, even road accidents. These are all the causes for various spinal disorders, and we can understand every year at least 1,000 people, even not even 1,000, the number will be very big. Every day, in a single day, more than 1,000 road accidents are happening throughout India. Even throughout the world, the number will be very big. At least 30 to 50% people, they are going on wheelchair because of involvement of spine, and people are undergoing spinal surgeries. And we can understand the magnitude of problem. All of us, we are aware of the Samprapti of Vatvyadi. Rudrasi, this is a very clear case. Sciatica, this description exactly matches with sciatica, but whereas when like L2 narrow root is involved, L2, L3 narrow root is involved, this classical picture we are not going to get. This is a classical picture of sciatica. So venesection in the tendocalcaneal area and cauterization, they have told, but anyhow, we have heard, even I have seen certain people practicing this technique, but I have not tried this technique. I have my own techniques with which I have made people come away from the problem, as well as years together they are comfortable, which I am going to describe very soon. This is also one problem. Kanja and fungu, when the nerve roots are absolutely compressed or at the level of cauda equina, if the compression is there, certainly patient is going to become paraplegic. Suppose unilateral compression very severe, there is a possibility of developing monoplegia on one side of the leg. So this is laterism. I have not treated. This is only a textual description. So first of all, we will see what are the strengths of allopathy. Then we'll see what are the strengths of Ayurveda. So the allopathic management broadly depends on non-steroidal anti-inflammatory drugs, opioid drugs, epidural, and some spinal injections, epidural injections, then various types of physical therapies. And if all these things fail, certainly they opt for surgery. And similarly, depending on the severity, certain times they judge and they straight away they will go for surgery. Non-steroidal anti-inflammatory drugs. All of you are aware, certain of the drugs are banned from even market. Analgesics and cortisones. Tramadol nowadays frequently used drug. Muscle relaxants. Nowadays market will muscle relaxant, non-steroidal anti-inflammatory drug and analgesics together, also combinations are coming. Corticosteroid, epidural injections. All these cases, people who have received all these type of treatments, either within few days after receiving these treatments failure, or otherwise after 6 months after receiving these epidural injections failure, I have received such type of cases. There is no other way. The next option is surgery. Suppose the traditional medicines fail, they will go for anticonvulsants. Gabapentin, nowadays frequently they are using gabapentin, pregabalin. And these are all various physical therapies. So this is a big area of livelihood for various physiotherapists. Heat therapy, cold therapy, ultrasound therapy, interfacial therapy, manual therapy, joint manipulation, pain relief physiotherapy, stretching and flexibility physiotherapy, dry needling physiotherapy, computerized decompressive spinal traction, core stability strengthenings. These are okay, especially nowadays in physiotherapy also, various specialties are coming. Physio, neuro specialty, ortho specialty, spine specialty, respiratory, like that they have big specializations, especially who are specialized in this spine area only can do all these things. Otherwise, a routine physiotherapy, heat and cold therapy, interferential therapy, and this traction. These are the routine things they are using. Various surgeries on spine, fascectomy, foraminotomy, laminectomy, discectomy, anterior cervical discectomy and fusion. Here, similar way in lumbar area also, posterior cervical fusion, similarly lumbar fusion. Means 2-3 vertebral, they try to fuse with plates. Artificial disc replacement, microdiscectomy. So especially nowadays, the most advanced is pinhole surgery, especially majority of the spine clinics, especially in Chennai Miyat Hospital, this is available. Within 3-4 days, they say that the persons can walk, can have a normal walk, microdiscectomy, pinhole surgery. Yeah, before going to Ayurvedic approach, I have seen people taking these treatments, whatever I have shown, repeatedly number of times, and ultimately suggested for surgery. Those are the cases, core cases for my management. Usually 70% of cases whom I have treated, they have not directly come. Once allopathic people, they say surgery, after doing all investigations, after doing all physiotherapy techniques, after receiving all internal medications, epidural injections, in different cases, different ways. Then as a last resort, they have approached me. 70% of my cases are like that. As I have told, the inspiration I have received, my first patient who has brought on a hand, Chamundeswari, she has brought on hand, posted for surgery in Vijay Hospital in 1998. At that time, I am not sure whether I can manage a case which has been posted for surgery with Ayurvedic treatment, because I am a buddy. My career has started at the time. After receiving and after treating that case, my interest has increased and I started receiving one after the other, probably around 3,000 to 4,000 spinal operations I might have avoided in these 22 years. And the rest of the cases, they are very simple. Everyone can handle. But only one thing is, what are all, if you want to get success, what are the mistakes we should not do? Because our strength is much higher and we should be the world rulers when compared to all sophisticated surgeries. I am not doing any big things. I am doing only simple treatments. Those simple treatments are sufficient to treat the difficult cases. These are the common medicines. Apart from this, also certain times I will go out of box. Otherwise, routinely I will use these drugs only. Vatakajankusharas, Lakshadi Gugulu, Septilin, Myostol tablets made by Salmonix, a sister concern of Dutta Vishatindukavati, Rasabhasma capsule, Lumbatone capsule, oils and for external application, Dhanvantram Thailam, Muriverna, Balagudichari Thailam, Suktihara Thailam prepared by Vaidya Ratnam, Aushadasala Valur. Any liniment you take, certain times there is a need for liniment. Mahamasha Thailam, Mahavishagarbha Thailam, Sahacharadi Thailam. So these are the only medicines I am using for the last 22 years. Very few occasions I will go out of the box. Medicines for associated complaints, because majority of the occasions, backache patients after receiving allopathic treatment, so many oral non-steroidal anti-inflammatory drugs and other medication, certainly they will come with gastritis. So, or otherwise they suffer from constipation. So these are the few drugs I am going to use in those conditions. Sukumara Kashayam, Indukanta Kashayam, Lagusut Sekar Ras, Lasunadivati, tablet Kayam. Means at different stages for relieving constipation, I have used different medicines like Dasimula Haritiki Lehya, Triphala Churna, Triphala syrup, and to be more refined, especially people who are suffering from spinal injury, suffering from bowel incontinence, the drug of choice will be Sagar Pharmaceuticals. There is one powder called Anulomana Churna. That is my drug of choice. I say that drug will give more comfort than the routine drugs which relieve constipation. That is Anulomana Churna by Sagar Pharmaceuticals. Especially people who met spinal injuries and who have developed bowel incontinence. I am very clear about this slide because I have told you how people are coming to you. It is not that a routine way you submit the patient to the massage. People who are unable to lie down, what massages we can do? Because for doing treatment, you require back, whether it is in lateral position, right lateral position, left lateral position, or in the ventral position, or in the dorsal position, or at least in the sitting position. Without this, you cannot treat. But without understanding which will be the convenient position, majority of the occasions, we will turn the patient on the bed. This is the first mistake we will do and ultimately land in failure. There are certain occasions I won't permit for first week or second week to even lie down on the massage table. Only in sitting position every day, 20 to 30 minutes, either once or twice, morning and evening, I will suggest treatment. And slowly, the amount of comfort patient is going to get, and we verify that which position, whether he is comfortable in lateral position, right lateral position, or left leg, only that position we have to use. Then only you will get the ultimate success. Otherwise, if you are going to move the patient without his comfort, ultimately we are going to land in failure. We have to stop our treatment. We have to refer the patient for surgery. Very simple. Tailapichu, Abhyanga, gentle, very, very gentle only. I have never used any vigorous massages, very gentle application. Patrapotali Sveda, Dhara local, Nadi Sveda, Kativasti. Why these many treatments I have? Again, I said, depending on the condition. A patient only can sit, cannot lie down. What Kativasti we can do, or what Nadi, what Potli, it's difficult. At that time, simple Thailabhyanga and Nadi Sveda. So over a period of time, gradually patient will get improvement. Then try to assume a comfortable position. So these many procedures. Navara Tepu, Navara Kili, Mamsa Kili, Rukshapinda Sveda, Valuka Churna, especially if you have understood the patient is having some amalakshnas or the rheumatological spectrum associated. Certain times it may be a true rheumatological disorder creating low back pain like ankylosing spondylitis, rheumatoid arthritis, or any seronegative arthrosis. At that time, only Rukshapinda Sveda or Valuka Sveda. Otherwise, there are mixed conditions. Patient will have a true mechanical low back ache. Along with that, Amavastha also. At that time, Ruksha Sveda along with a light Abhyanga and Nadi Sveda. Like that also we have to adopt. Because these techniques, if we are not going to follow, certainly the failures will be more. How do we know whether we have a failure or not? Because majority of the practitioners, they don't have a habit of following the patients. If the patient is not appearing after your treatment, probably assumptions are you have treated the patient, he is comfortable for years. Or the patient did not get improvement, patient had a relapse, he started visiting multiple practitioners, or otherwise ultimately landed in surgery. We don't know. So that is the reason from the beginning, when I have started my clinic, the day when repeatedly I am telling Chamundeswari, the first case which I avoid surgery, even today I am following, but not all patients, the magnitude is very large, 4,000, 5,000. So at least the noted cases which I am going to show today, all those patients I am following, they are comfortable, they are not going anywhere, they have a comfortable, they are leading their life comfortable. So this habit, every physician has to inculcate that at least for few years, follow the patients, then you can understand your strength. Whomever you are treating, they are successful, or otherwise the failures are there. More failures means we have to rethink and we have to remodify our treatment. And in my practice, I have used very on less number of occasions Vasti, not on number of occasions Matra Vasti and Erandamuladi Kashaya Vasti, hardly 10 to 15 times, not more than that. Majority of the occasions I have used only external medicaments, which are very simple. The advantage for young doctors is to attempt, you need not fear about Vyapats and other things. Only the thing is, due care, you have to adopt these procedures. Success will be 95%. And once again, cases that require inpatient admission, spinal injuries, spinal canal stenosis less than 5 mm, osteoporotic vertebral compressive fractures, spondylolisthesis up to grade 3, because I have not received so far grade 4. At this juncture, what is going to happen in grade 4, I cannot tell at this juncture. But up to grade 3, you can protect and you can avoid surgery and you can make the life of the patient comfortable. Low back pain with bowel and bladder incontinence, better don't try to treat in OPD level. These are the cases to be treated as inpatient, especially low back pain with bowel and bladder incontinence. And one more, Khada equina, better even there is a requirement of certain times allopathic doctors, because suddenly these patients will develop bladder incontinence, you have to catheterize. Certain times the bladder, the urine won't come, you have to train the patient for catheterization, frequent catheterization, removing our, because permanent catheterization, there are so many problems like catheter-induced hyperpyrexia, frequent bladder infection, cystitis. Instead, we have to train the patient for frequent evacuation of the bladder. So that is the reason these are certainly cases not to be handled in OPD level. Post-surgical relapse, post-surgical sequelae, certain times patients will come to you, operation is successful, but they will lose their legs, or again within few months, few days, they will have agonizing backache and different presentations. So certainly those type of cases better not to handle in OPD. Severe neural foramina compromise, don't handle in OPD. Partial or complete sacralization of vertebra. Certain times we may get results even in OPD level, but these are the cases, they suffer badly, better to treat in IPD. Now, I am sharing few cases. I have documented several cases, but majority of the cases still they are in pen drive only, they have not been edited. But few cases we have edited, which we can say, these are our real strengths, that you can imagine the magnitude of operations happening, at least in India, per day 400 to 500, minimum number of operations happening in all leading cities on spine, minimum. But all these operations, at least 90% to 95% operations, we can avoid. There is a great strength in Ayurveda, especially spinal disorders. Ayurvedic management of spinal disorders can be taken as a specialization. Yes, it can certainly give livelihood for all of us. This patient I have treated somewhere in 2005 for 21 days in our hospital, who has undergone a spinal surgery, normal open surgery. But within 6 months, he had a relapse, unable to manage. When he approached allopathic doctors, they asked for a second surgery. All of you can see. You can see the first surgical scar. In this patient is able to lie down on ventral side. Successfully, we could make out cutty, all these things, all of you are aware. But only one thing what we have to see is the area of lesion, because majority of the occasions I observed, when other people are doing and people are not following, certain times they will prepare a very small cutty of size, but actually lesion is not here. Certain times the lesion may extend even up to L1 also, the multiple lesions are there. Basing on that, you have to prepare cutty. It is not that whether you prepare a small one or a big one. And always prefer the height of the wall will be big so that you can accumulate the oil. Otherwise, here there is a curvature. Even certain times 200 ml oil also there will be proliferage. So even today, this patient has not undergone second surgery. He is quite comfortable leading normal life. He is an MMTC employee. Whenever they will have a problem, they will talk to me and I will come to know that they are safe. This is post-surgical relapse. Like this, every month we used to receive 3 or 4 cases. And surprisingly, yesterday I was in Hyderabad. One of my first batch student, we had a discussion. Nowadays, he is receiving more post-surgical relapses. All patients with Ayurvedic management, they are also comfortable. This is one inspiration for all young doctors who are seeing this can be taken as our profession. This is one case, spondylolisthesis. This is only grade 1. How it has happened? The boy was attending martial arts. At that time, somewhere in 2004, he suffered from a what we call wrong position. He fell down. After that, he developed back pain. His situation was that he cannot sit in the classroom for not even for 20 minutes. All of you are aware that those days physical classes more than 6 hours students have to sit, and unable to manage. Father is a chief pharmacist in a defense hospital, and they have visited more than four orthopedic surgeons. Everyone has opined only operation. Ultimately, because being a medical man, they are aware of the consequences of an operation, especially on a small boy. Suppose if he 50% success, if he is going to lose his legs or anything, so they are worried. Hearing somebody, they have come to me. Actually, this boy, first case for me treating spondylolisthesis, and it's almost 2004 I have treated this boy, and 2 years before I have attended his marriage. No operation. Listhesis is as it is. Boy is doing all his normal work. At that time, 2004, grade 1 listhesis. 2-3 years before, I have treated even grade 3 listhesis. Approximately 4 or 5 cases of grade 3 listhesis I have had it. Successfully I have treated. I am following and they are comfortable. This is the small problem creating. Sorry, I should not show, but anyhow, I have to, once again, I have to edit. I did not have that much of time. This is scrolling. Case somewhere around 2007, this case. In 2007, the cost of operation is 1,25,000. Today it is much more, 3 times. Imagine how much money is flowing in treating spinal disorders. So, certain times patients, they come with very severe pain. And this is one example. Acute intervertebral disc prolapse. He has not come to my hospital immediately. After spending 4 or 5 months, like in that position, within 14 days, he got very good improvement. Actually, this picture we took with a 1.5 pixel normal camera.
Very good. அப்படியே நில்லுங்க, திரும்பி நில்லுங்க. ஓகே ஓகே, நீங்க மூஞ்சி காமிங்க அப்படியே.
So this is one presentation: severe compression, motor compression, bilateral motor radiculopathy. After first round of treatment for 21 days, patient is able to walk without support on his own. There is a mild weakness. After 2 to 3 treatments of each course 21 days, nowadays patient is traveling even in a normal bus, city bus, everywhere he is going alone, leading normal life. No one can believe that he has suffered badly this much. So these are all the motor nerve compressions. Gradually, they are developing weakness in the lower limbs. This may go up to total paraplegia. This is one more case, similar case. In this, the specialty is, this gentleman is, he is taking regular treatment. The two, he consulted so many allopathic doctors, took MRI, but he could not find any big improvement. He started visiting 1 or 2 big Ayurvedic doctors. Probably because of their hectic schedule, they have not noticed, and more than 1 year he followed Ayurvedic treatment. Day by day he is sinking, but they have not understood the condition, and they routinely they are giving oils for and medicines for home. So with somebody's reference, he came to me. The moment when I saw, I scolded the patient, why do you did this much of delay? Then he said, where I have delayed, I have followed all allopathic doctors. I am constantly following Ayurvedic doctors, but still my condition is like this. Then I have gone through his complete fight, because when you are in OP per day for 40 patients, 50 patients, when you are seeing, it's very difficult to peep into all details. So then I have gone through the entire details. There is no mistake from patient's end. It is only mistake from physician's end, that they have not observed that the patient is sinking and gradually developing motor weakness. That without support, by the time he has come to my clinic, without support, he cannot walk. Then the next moment I asked, all these days you have tried only oral medicines at home. This is not possible. You have to admit, if you listen my words, I will treat you. Then immediately he accepted. Approximately 21 days of treatment for 2 times I did. And even today on his own, he is going in metro train, climbing stairs in railway station. He has become independent almost more than 10 years. More than 10 years. And the way he walks, I will show you in another video clip, and we will move to the next one. Similarly, this is also a motor radiculopathy. Surprisingly, this gentleman met a road accident. Almost more than 2 months he stayed in an allopathic hospital. Afterwards, he has recovered, able to walk, but he has a severe weakness of lower limbs. He cannot do, he's basically a sub-inspector. He has to attend for march. Otherwise, he is not fit against medical grounds. He is forced to take retirement. This patient, when he came to us, I said, okay, get admitted. I will treat you, you will become a normal individual. Accordingly, I have treated him 2 times. And to my surprise, he has regained his gait, able to do march. And after that, 2 to 3 years, he did service and he got promotion as inspector, from sub-inspector to inspector. And he took a natural retirement against medical retirement. You can see the both slides, how he is walking. This is a best example that you can help several people who are suffering from road accidents. The more earlier, more benefit you will get. If it is delayed by 2 years, 3 years, the amount of success will be poor. But even then, people are getting improvement, but the earlier they will get very good improvement. Better if you can bring people within days, but at that time we require the support of allopathic management also for bladder incontinence, bowel incontinence. If necessary, we have to keep finger, what we call wear a glove, and we have to remove. So all these supporting measures are there. Even we can admit even acute cases. So on one occasion, when I have admitted such patient did an abnormal movement and developed neurogenic shock. But luckily, we have a team. At that time, immediately they have come and they have managed. Otherwise, the patient would have died. Osteoporotic vertebral compressive fracture. Every year, more than 1 lakh Indian women are suffering from this type of osteoporotic vertebral compressive fractures. Actually, whatever you are seeing in this picture, the left side, this video we took on 8th day. Day 1, she came on wheelchair, almost screaming with pain. But even on 8th day, just please go through. Once again, I am playing this video. The other side, she's a normal lady. You can see within seconds, she is able to walk, doing all her works. This patient I have followed for more than 5 to 7 years. There is no relapse. She is quite comfortable. Like this, several patients are benefited from our hospital. So this is also a very good area. Nowadays, so much of people are so panic about just osteopenia and just porosis. This case is an example. Even though they have a fracture on spine, unable to move, unable to walk, also you can help them and make their life normal. Then it is very simple. Treating osteoporosis and osteopenia is very, very simple. Dr. Gopi Krishna.
Yes, sir.
Am I exceeding time?
Sir, no problem, sir.
I think this is canal stenosis less than 5 millimeters. And patient almost spent his time more than allopathic doctors suggested surgery. Almost more than 60 days he spent his time in bed. The similar way he came to our hospital. It took for me also 2 to 3 visits it took. And ultimately, he has become a normal individual. He could lead normal life even today. Even after this, I have treated one case, spinal canal stenosis, 0 space also we have treated. That is our own student's mother. She is also quite comfortable. It is not the size of the canal. Usually below 9 mm, people will afraid to take the case. Below 5 mm, mandatory for surgery. But I have treated one case, 0 space also at L3, L4. Probably we are coming to an end. Non-compressive, because we spoke about the either compression of the narrow root, compression of the disc, posterolateral compression, anterolateral, anterior compression, like that. This is a peculiar case. Only one case I have received, but worth listening all juniors. The lady whom you are seeing on screen, she was an engineering graduate. Attending her farewell party, for the sake of fun, somebody has removed her chair. Immediately she fell down in sitting position. That impact falling on floor, especially in sitting position, created a great impact. Physically, she is not having any injuries. Initially, there is some amount of pain which has subsided. Almost 1 year, she was quite normal. After 1 year, slowly she developed a weakness in lower limbs. It has grown to such an extent, with the help of support also, with great difficulty, she will walk. In this video, this is what happened is somewhere, even though there is no compression, there is degeneration of spinal cord. Degeneration of spinal cord without compression. Because of that degeneration, she developed paraplegia. Total paraplegia is not the paraparesis. And what you are going to see in this video is, after 2 or 3 years of the incident of developing the complaints, after visiting all major hospitals in Chennai and Hyderabad, somehow she has come to our hospital. Initially, this is a new case for me. Only one case I have treated. Because when we start treating number of patients, what will be the direction, we do not know. But in one case, my observation is that patient could walk 20 feet in 144 seconds, whereas after treatment, patient could walk the same distance in 37 seconds. Of course, these people are from Chittoor, Andhra Pradesh. They have not, because the state where they are in, different people will suggest different types of treatments. So they have gone for some other treatment because of hearing the way they have told the patient. But I have followed the patient for at least 4 or 5 years. Still I am following his relative, but she did not get any big improvement. Whatever the initial improvement she got, there only she stands still. Even today also I can speak to this patient, but she would have come for repeated treatment. But it has given us a focus and idea that these type of cases also, they are responding to our treatment. Watch the video, please. The way the other screen she is walking, the initial picture on the left side you can see. The other side video clip is over. Within 37 seconds, she could walk 20 feet, but the same 20 feet in the initial stage of treatment, it took around 147 seconds. So this is very, very interesting. Few cases only I have treated such type of cases, but treating this case, I have understood that majority of the road accidents, if they are brought and some amount of integrated approach is there, most of them we can make normal individuals. This patient met an injury on spine, spinal cord contusion. He developed quadriplegia. On his own, he cannot do anything. With severe pain and with a hard collar, because whatever picture on screen you are seeing, this is on 8th day, not on day 1. Probably seeing his condition, I would not have taken this case, but doctors told that operation is mandatory, but he is going to lose legs. Certainly he is going to lose his legs. Then one of our employees, close relative he is. Then they are not interested about the treatment. And without telling me, straight away they brought this patient to our hospital. Initially, I hesitated to take this case, but luckily, with the support of all our staff, especially physiotherapists, we took the case. But that hard collar, even if we try to remove, the patient is going to scream. Such a bad condition he came, but somehow we managed. We used to keep only thylapichu on the neck and we used to close. Patient has to lie down like that only. After 8th day, the pain has subsided, allowed us to remove the hard collar. Like that only we have kept the patient in bed. We have assumed the comfortable position. Another 1 week to 10 days, we treated bedside treatment only. We have brought all our treatment procedures to bedside. You can see the patient is 6 feet, 3 feet. A normal cot is not sufficient for him. That is the reason we have combined 3 cots and we made him to lie down in an odd position. Otherwise, he will fall down. And the legs are going beyond the cot, normal cot. And to our surprise, it took total 3 months to treat this patient. Even today, I can speak to the patient. Patient is absolutely normal. No one can identify that patient has suffered such a bad situation. And everywhere on his own is going. He can climb a car, metro station. He can climb stairs. All his activities he is doing normally. This case is an inspiration that spinal cord injuries, especially road accidents or any injuries, if they are up to contusion or hairline fractures, certainly we can take, but some amount of issues will come like bladder retention, urinary infection, high fever. These are the associated things. If necessary, we have to take the help of the allopathic doctors. So certainly, because the entire life they can happily live with their legs. Then I have seen several patients operated who have come on wheelchair, lifetime permanently they are on wheelchair. So probably this is a better way of treatment. It took approximately 3 months for us to treat this patient. When at that time he was using collar, nowadays absolutely free from anything, no relapse, absolutely normal. So this case is an example that there is a great potential even in handling road accidents where the spinal vertebra has not broken into multiple pieces. We do not know how, if they are in because in such cases they will try to fuse the vertebra with the nails or with plates. But we do, even in those cases also we can venture or not. Carefully we have to do. So we have probably we are coming to the last slide. This slide purposefully not related to current topic of spinal disorders. Why I have kept is, usually we will give instructions and we will leave it to masseurs. They are not technical people. They are not technical people. And whatever they will know, that only they will do. This will happen many number of times, on many occasions. You see, I wanted to treat this patient with Dara only on hip joint. This is a case of slipped femoral epiphyseal joint. Luckily, I noticed that when one of my students has brought this, I understood what is the mistake happening. This gentleman, instead of spending time on hip joint, middle of the thigh and the lower aspect of the thigh, he is doing more massage, which has been rectified. Actually, the upper portion where hip joint, that is the area you have to focus. After rectifying only, we got the result. Similar way, these type of mistakes will happen with masseurs when we are doing a number of occasions. One more event I will tell and I will close my lecture, that when I was busy in my administrative activities, I have admitted one patient who is suffering from Madam also, Sheila Madam also, she saw that patient. That excruciating pain, unilateral radiation. Almost 21 days of treatment is over. Patient is not getting improvement because at those days, once in 2 days, 3 days, I used to attend the ward because we have to discharge the patient. And I received a message from one of our sisters that patient still suffering from severe pain and telling his wife that I wanted to commit suicide. Imagine, at once I have become panic, either to keep the patient or immediately I have to send him out of the hospital. Otherwise, any such type of incident happens in hospital, our career will be out. But immediately I went to the patient. I spent 1 hour of time. What is happening? I asked. I understood. Masseurs are turning the patient on the table on all sides. This patient can assume only left lateral position. Beyond that, he is not having scope in any other position. That too, left lateral position, right leg in flexed manner. That is the only permissible position. All 21 days, these people are moving him all the directions. That is the reason landed in failure. Then that day, immediately I attended the patient. Myself, I did massage. We continued the treatment for another 21 days in front of our eyes with a smiling face, without pain. He moved his home. And this patient has been followed for almost 3 to 4 years. And he has back to his normal work, driving car. He has lost his livelihood. So guiding masseurs, assuming comfortable position in handling these type of patients is very, very important in getting success, which we won't get in our books. So, and I can, because it is more than 20 years of work, I can narrate so many field situations, field experiences, but the time I think I have exceeded. Thank you very much. Sorry for taking more time. Thank you very much. Thank you for organizers giving me this opportunity.
Thank you so much, sir, for a wonderful session. Probably the time has increased, but we have got more knowledge from you. We got to know what we are doing mistakes and how to learn them. So from the team of IIAR, I would like to thank you for giving your time and presenting a wonderful session for us, sir.
Thank you.
Thank you very much, sir. It was wonderful.
Proceeding to the next key speaker, I request Dr. Nagaveni to introduce Dr. Satyanarayan Bhatt, sir.
Everyone. I am very pleased and honored to introduce our speaker for today's second session, Dr. Satyanarayan Bhatt, sir, who has completed his BMS from SDM College of Ayurveda, UP, and MD in Bhaishajya Kalpana from IPGTRA, Gujarat Ayurveda University, Jamnagar. Presently, Sir is Principal, Medical Superintendent and Director, Research and Development at Munial Institute of Ayurveda Medical Sciences, Manipal. With an experience of teaching for last 21 years in Rasashastra and Bhaishajya Kalpana for both undergraduate and postgraduate students, Sir is also guide for PG scholars. And working as an R&D executive, MR for ISO in Ayurvedic Pharmacy, Munial Ayurveda Research Center, and actively involved in design and development of Ayurvedic formulations, quality control of Ayurvedic medicines, research on single herbs and herbomineral preparations, clinical research in Munial Ayurveda Hospital under various Chikitsa Kalpas. Sir has more than 20 research papers published in national and international journals and is a reviewer of 3 international journals. Sir has presented more than 75 papers in various national and international conferences, besides chairing the scientific sessions. Sir is awarded with Edward Kennedy Memorial Award to the best presenter from the senior research category, Shobita Memorial Award, and Best Paper Award in Colombo, Sri Lanka at Gary International Conference. Sir has keen interest in the field of medicinal plant and herbomineral formulation research, quality control of herb and herbomineral formulations, and biological standardization of Ayurvedic products. Sir, we welcome you to address the session on Rasashastra in clinical practice. Thank you.
Thank you. Namaste, everyone. Thanks for joining me today. At the outset, let me congratulate Dr. Gopi Krishna and his team, not for just completing one successful year of Indian Institute of Ayurveda and Rasashastra. More than that, for reaching the concept to the different corners of the country and inspiring various young budding doctors to practice Rasachikitsa. This is not the first. I think this is an organizational effort that we are doing for last 1 year. Before that, I know Dr. Gopi Krishna for several years with this selfless personal effort. He has been doing this to encourage young minds towards Ayurveda practice with a key focus on Rasashastra. So without much delay in this probably the odd time, so let me begin the session. Hopefully my slides are visible to you.
Yes, sir.
Thank you. The title here given is Rasashastra in regular clinical practice. So that is the motto with which you are conducting the entire curriculum. So this is a matter of several hours, maybe running for months together if I speak with this, so many evidences. But this is a very basic presentation. My idea is just to give you the insights on some precautions, some important criteria, guidelines that you have to take in using Rasashastra with some hand-picked examples here and there, depending upon the time that is available in the second half of presentation. So let us begin with the salutation which I usually do. Yasya Ananda Bhavena Mangalakala Sambhavitena Spuradhamna Siddharasamritena Karuna Viksha Sudha Sindhuna Bhaktanam Prabhava Prasamriti Jara Ragadi Rogaha Chanat Shantim Yanti Jagat Pradhana Bhishaje Tasmai Parasmai Namah. A couple of customary slides which probably we present in all our presentations on Rasachikitsa. So when we observe the clinical use of Rasashastra in regular practice, we are observing lots of geographical differences. However, the scenario is changing for last a decade or so. Otherwise, we had a set of formulations that were being practiced in Karnataka and very few Rasashastras in Kerala and many Rasashastras in northern part of India, especially in Rajasthan, Uttar Pradesh and Gujarat. And I have also seen the people who are prescribing combination of n number of Rasashastras mixed together, several arsenicals, several bhasmas, and preparing pudika and giving it to the patients. And I have seen the practitioners who are unknowingly giving Rasashastra and claiming themselves as they are not at all using any mercurial or rasa preparations. So let us not comment on them. But in younger generation, it is really very heartening and interesting to see that there is an attraction and a scientific inquisitiveness to practice an authentic Rasachikitsa in their clinical practice. There are many events, many programs like this that have motivated such people. I still remember a decade ago in Kerala, the people were afraid of using the term rasa Only a few practitioners like Dr. Shashikumar Nichil or Dr. Unnikrishnan, who had a background of Jamnagar and traditional familial background, were preparing Rasaushadhis and using. But now the scenario has changed to a great extent. The Kottakkal itself is preparing Rasaushadhis. But unfortunately, what we are seeing in today's scenario is the majority of Rasaushadhis have vanished in the clinical practice. There are more than 10,000 formulations. Only a few are being used, even though their clinical application is increased, but many Rasaushadhis have remained unexplored and not used. So let us just motivate ourselves with these classical statements. What Rasindra Chudamani states, Sarpa Himatra Vipala Gunascha Sadyohita Deepana Pachanancha. Smaller the dose, higher the potency. And this particular phrase is very important according to me. That is Sadyohita Deepana Pachanancha. Most of the Rasaushadhis do have this property of Sadhya Deepana Pachana. They are bioenhancers. They are bioavailability enhancers. They help for quick absorption, quick assimilation, and also for the targeted drug delivery, which is the beauty of Rasaushadhi. Since second BMS, we have been talking, Alpamatra Payogitva, Ruchera Prasangata, Kshipram, Arogyadaitva, Doshati, Pyo Adhorasa. Smaller the dose, quicker the action, more potency, and no problem with palatability. There is a statement here which you can see in the last line. Asadhyeshu api datavyaha rasovatah shrestha uchyate. If we are sticking to our classical guidelines, you are not expected to treat the pratyakshaya patients who are at the imminent deathbed. But it is the responsibility of every physician to try till the last breath of the patient, so that his life expectancy can be improved, his suffering or misery can be minimized, his quality of life can be improved. In such situation, it is always Rasaushadhi that comes to our rescue. When we feel that none of the drugs, none of the modalities are working in the patients, so let us try this particular Rasaushadhi, this particular Kottali or Bhasma or Gupipakva Rasayana, and it will help you, at least to some extent, to relieve the misery of the patient. Rasachikitsayam Saukaryam is what we should always be aware of. The statement which is repeated in many of the platforms, na doshanam, na roganam, na pumsancha parikshanam, na deshasya na kalasya karyam rasachikitsite, is many a times wrongly attributed, which I say in all my presentations. Doesn't mean that you don't have to examine dosha, dushya, or other parameters like desha, kala, etc. before administering Rasaushadhi. Whenever possibly do all of them, it is the best. But when you have no opportunity to do them, that is, the patient is entering to your clinic and just collapsing in front of you, you do not have the time to assess all these factors in the patient. You have to give something so that patient comes out of this emergency crisis. So then it is the Rasaushadhi which you can give without thinking twice. That is why it is rightly said, Sarvashastrartha tattvajno najanati rasam yada sarvam tasya upahasaya dharmahino yathamutaha. A physician may be having idea of multiple therapeutic modalities, so many formulations, a knowledge of various scriptures, but has no knowledge about rasa. So everyone will laugh at him or mock at him, just like a person who is not following any religious disciplinary life. So whenever we talk about the application of Rasaushadhi in clinical practice, couple of things which we should always remember. First are related to the pharmaceutical factors, and second are related to the pharmacological, including clinical factors. If you are not addressing these factors properly, surely you will end up with all the trouble related with the ADR and toxicity of Rasaushati. And you will have to face blame from not only the patient party, but also from so-called the scientific community around you. That is why in Vaishadya Ratnavali, he has mentioned Rasakhatita Dhatvadi Shodhanopadesha. So whenever the word Rasaushati is used, we know that that Aushadhi need not contain Parada. It may be a Parada containing drug or Parada with many more metallic or mineral components, herbal components, or it may not have any Parada or Parada derivatives. It may be having some metals and minerals, or it may not have even Parada or any metal and mineral, but may be having only Vishadravya. I repeat, only Vishadravya. Say Nabhivati or Vishatundukavati. That is also called as Rasaushati. A rasa refers to the potency of the drug, and it is defined that even if a formulation doesn't contain a metal or mineral, it can also be considered as a Rasaushati. So all those parameters which we will have to consider with all the precaution are applicable to Dhatu, Upadhatun, Vishanyapi, Samshodhya Vithina. So after selecting the raw materials of genuine standards, subjecting them to particular processes of Shodhana becomes extremely important. This is the area where, if at all we compromise, we have to face all those issues related with the safety. So if it is not done, dosha sanjayate anyatha. Another important factor related to the pharmacological or clinical aspect is rasasevane anupana prakara nirdeshaha. Again quoted in Vaishadya Ratnavali. Anupanai rasa yojya desha kalanusaribhi doshagnai madhuna vapi kevalena jalenava. Any rasaushati should always be administered with the proper anupana. Role of anupana here is not just to enhance the therapeutic efficacy. Of course, many anupana, they are acting as bioenhancers, but at the same time, they can modify therapeutic aspect. They may help you to see that the drug is delivered to the particular target and a specific type of pharmacological action can be expected. And more than that, Anupana is also helpful in minimizing or eliminating any toxicity or possible adverse interaction of that particular drug. Always administer Rasaushadhi with a specific Anupana. I remember saying of Dr. Krishna Prakash, one of an ardent, hardcore Rasa practitioner, whenever you administer a Rasaushadhi, try to administer it in powder form, mixing it with the specific Sahapana and Anupana. Majority of Rasaushadhis, maybe the Khalviya Rasayanas, are in powder form. We may be converting them into a tablet form for our own requirement. A few may be there where Gunja Matram, Vatikam, Kritva, like references are there. Their purpose is the dose precision. Even in such situation, whenever possible, powder them, mixed with a specific Sahapana and administer it, followed by a specific Anupana for the best therapeutic results. So Anupanai rasa yojya desha kala anusaribihi. It may be drug dependent, or it may be depending on desha, kala, etc., or disease dependent. Decide the Anupana. Or doshagnaihi, follow doshagna Anupana. You know very well, Snigdhoshnam Marute Shastram, Pitte Madhurashitalam, Kafe Anupanam Rukshoshtam. Decide the Anupana based on the predominant dosha involved in the particular disease in the patient. If nothing is possible, you have two options. One is Madhu, which is the best Anupana. Jala is best Anupana for Ahara, Madhu is best Anupana for Aushadha because of its Yogavahi property, Yogavahi Param Madhu. Or at least finally you can use Jala as Anupana. So whenever possible, stick to the right Anupana. In my all lectures, I mention this. Whenever we talk about any product, we are concerned about three issues: quality, safety, and efficacy. In the case of Rasashastra, these are still more important. Whether this product is of optimum quality or not. Is it safe for me or my patient? Is it efficacious for the purpose that it is being used? If your answer is yes to all these three questions, your work is done. You don't have to worry at all in using these Rasashastra in clinical practice. It is expected to a great extent that if quality is assured by following all the criteria related with the quality protocol, starting from raw material till the finished products, all GMP guidelines or classical guidelines, it is expected that the other two, safety and efficacy, are also taken care of. But in the case of Rasashastra, that is not sufficient. Apart from the pharmaceutical aspects, there are other things related to the judicial application of Aushadhi, which ensures the safety and efficacy. We get lots of evidences regarding efficacy, pharmacologically and also clinically. The first shloka of Alpamatropa itself highlights the same thing. Only one aspect of this I would like to mention you with just a couple of slides. This is an entirely different aspect which needed to be addressed with much more details, that is safety. We say in all the platforms that Rasashastra are safe. So I have not seen any adverse effects. But is it true? It's definitely not true. There are many incidences where toxicity have been reported with the Rasashastra. I don't say that it is because of the drug. It is because of faulty preparation and faulty administration. We have to accept that such incidences have occurred and can occur. We should explain to the scientific community in an evidence-based manner regarding the causes for them and when and how they can be used safely and efficaciously. Otherwise, there are several reports here. This was the report from New York Health Department in 2015, where 20 Ayurvedic compounds were blamed to have high level of heavy metals. A case of a lawyer in Iowa was reported in 2010, who reported with memory disturbances, many neurological deficits, weight loss, etc., which is attributed to a bhasma from India, due to which his blood plasma level showed very high amount of lead, almost 9 times than prescribed limit. Another paper published by Breher and others have shown that in about 115 people who were taking Ayurvedic medicines, at least 40% had lead poisoning. There are many such reports between 2000 to 2003, 2004 to 2008, from New Hampshire, California, Massachusetts, Texas, New York. You can see here heavy metal poisoning from Ayurvedic medicines. Gunturu et al. Has published a case of 58-year-old woman who had hepatic impairment, anemia caused because of lead poisoning, who had to be treated with IV followed by oral chelation therapy. Dr. Urmila Thatte Madam also has presented a 62-year-old male patient's case who was a known case of diabetes, and he was taking insulin and glibenclamide and was maintaining normoglycemia. He was given with Ayurvedic drug for psoriasis and he developed sudden hypoglycemia and he succumbed to that. He expired. Here we will have to blame the doctor because many of physicians have no idea regarding the interaction of Ayurvedic drugs with allopathic drugs. It's not just herb drug interaction, it may be even mineral or metallic drug and allopathic drug interaction. There are several such formulations and herbs which have proven to improve the bioavailability and efficacy of anti-diabetic drugs like metformin, glibenclamide, and pioglitazone. The physician should have asked the patient to taper the anti-diabetic drug that he is taking. Here it is a favorable interaction, but it is essential for us to have these knowledges before using such drugs. Otherwise, unnecessarily, we will be blamed. This is another such case published by Mikulisky and others. One more by Raviraja A, where 3 cases of lead toxicity are reported who were taking Ayurvedic medicines. They had to be treated with dipensilamide. Sathe K also has reported mercurial toxicity reported in a 2-year-old girl, which caused acute anuric renal failure, who was successfully treated with chelation. So we cannot escape ourselves telling that oh, everything is fine and safe. We will have to answer these, but this is not my purpose that to create any panic situation. This is my intention to make you to be aware and awaken to the status around us, and we should be proud that we can administer Rasashadis in such a way that they do not cause any of these problems. Majority of allopathic drugs, they are to be used with utmost caution. So why not Rasashadi with some proper caution while administering? So administration and preparation both are to be given much more importance. I have several links, so let me not talk much more on them. So in relation to this, let me just mention certain important factors related to Rasashadi administration. First and foremost thing which is there in this list is the dose. An appropriate dose. It should neither be more nor less. Excessive dose or overdose should be avoided. One thing I would like to highlight in this platform is that none of the metallic and mineral formulations do cause acute toxicity, maybe with an exception of arsenicals, that too, oxide or chloride formulations, somala containing formulations or rasakarpura like formulations, if at all they are used in very high dose. Otherwise, none of Rasashadis cause acute toxicity. They are prone to cause cumulative chronic toxicity if you do not know at what dose and how long they have to be administered and what adhyapatya and what adjuvants that you have to use. In many of the occasions, it is the toxic herb that can cause acute reactions. For example, Vatsanapa, Kupilu. If Shodhana is improper, incomplete, and the dose is too high, that can cause life-threatening adverse effects. I know the cases of Vatsanapa toxicity, where it has caused cardiotoxicity, cardiac arrhythmia, sudden hypotension, patient collapsed. Vatsanapa, which is cardiotoxic, if subjected to proper Shodhana, aconitine gets converted into pseudoaconitine or acetylaconine, which is a cardiac stimulant. It's a cardiac tonic. So it is our responsibility to ensure this. Then the time of administration, when you have to give it, whether it's appropriate or not. Then the vehicle, as I already mentioned. Then the diet and routine management, which is very crucial. Then you should also concentrate on shelf life. It is not that all Rasaushadhis have infinite shelf life. You know the cases of Nagabhasma or Tambrabhasma, which you will have to repeat putta after a period of 5 years. Otherwise, they will not only dissociate into free metals or into, they may reduce into some other compounds. They may cause some adverse effects also. A processing technique, the pharmaceutical factors. Then testing parameters. The final product should be tested with adequate parameters, not just basic physicochemical testing, including advanced instrumental techniques to confirm their characterization, proper identification, authentication, and approved variety of the sample, which is extremely important. Concept of Prakriti. Then another major problem is over-the-counter use of medicines. Unfortunately, even the Rasaushadhi can be purchased over the counter without any prescription, where the patient may not be having an idea how to use them, when they have to use, whether it is the right company. They will not be having an idea. So this is another major cause for the reports of toxicity or ADR with Rasaushadhi. Lack of proper knowledge of Rasaushadhi. Out of all these, a few factors are extremely important. First is the quality of product should be ascertained. To get it certified by the supplier regarding the quality. If at all possible, in your clinical practice, you can test. For Bhasma, some simple tests like Varikaratva, Rekha Puranatva, Unama gives you lots of information. Nishchandratva and Bhasma Varna, that helps you to a great extent. Or Avami, Niswado like tests also will help you to a great extent. The Adhipariksha is a simple yet very useful test. Or you can go for even Namburi face spot test. You need not follow a very advanced technique to confirm the quality of product that is supplied to you. If you are able to assure it, then to a great extent, safety and efficacy are taken care of. Dose must be appropriate, which depends upon classical guideline, patient's age, sex of the patient, time of administration, potency of the drug, form of drug. So you will have to decide it in such a way that it falls between the minimum and maximum tolerable dose. A proper vehicle, which I already mentioned, I always quote the example of Rasamanikya, a wonder drug in clinical practice, simple to prepare, very useful in multiple clinical conditions, starting from Kushta up to respiratory disorders. This should always be administered with Madhu and Krita. In a study carried out by Dr. Shiman Narayana, it is well established that in subchronic and chronic toxicity study, if it is acute, subacute, okay. In subchronic and chronic toxicity study, when Rasamanikya was administered with Anupana like water, it had shown uterine toxicity, it had shown fatty infiltration and necrotic lesions even in liver, which was not there in those animals which received Rasamanikya with Madhu and Krita. So a proper vehicle has to be used. Then the course or duration of treatment, in certain situations they have given Mandala Prayoga, whether the Mandala has to be repeated or not, or 3 Saptavaram. So many such references, 3 Saptaham or Ekavimshati Dinam. So many such course or duration of treatment are defined. They have their own importance. Many times you may have to discontinue in a particular Rasaushadhi, which you will have to administer for a pretty long time, so that any possible accumulation of the drug that has occurred can be chelated and removed by body mechanism. And after a certain gap of 2 to 4 weeks, you can restart the administration of the drug. Pathya, including Kakarashtaka, which have their own important role in Rasapachana or as antioxidant or as chelators, should be considered to minimize adverse effect and increase the potency of Rasaushadhi. So these are the basics which I wanted to highlight. Let me give some handful of randomly selected examples. When we talk about Rasaushadhi, we usually focus to the Murchita form of Rasa. Paraga can be administered in Mrita, Baddha or Murchita form. Some may be intermingling. For example, we have Parpati. Parpati is a Sagandha Niragni Murchana. It is also about a Bandha. So when you have to administer Rasaushadhis in clinical practice, out of these three varieties, probably we will be focusing on Murcha. Avashya Vyadhighatakatvam, Nishchitya Vyadhighatakatvam, or Avyabhicharita Vyadhighatakatvam is Murcha. Here, we have to process the drug in such a way that it becomes certainly capable of curing the disease. A therapeutic success is to be ensured, then only it is considered as a Murchita Rasa. It may be Sagni Niragni, Sagandha Niragna, Sagandha Nirgandha, or depending upon the process and the form, Khalviya, Parpati, Kupipakva, or Pottajarsanas. So this forms a major part of our clinical application of Rasaushadhis. Apart from these Khalviya, Parpati, Kupipakva, Pottajarsanas, we have Bhasmas, we have Pishti, we have Lauhakalpa, and some other forms also like Rasamanikya, or even some Avalehas, which contain lots of Bhasmas and Pishtis in them and can be rightly attributed the form of Rasaushadhi. Some random examples under these categories. I'm not going to explain the examples of Khalviya Rasayana because there are hundreds that are used in clinical practice. If I take up the examples like Arogyavardhani or Mrityunjaya Rasa or Sutashekara Rasa or Shwasaputra Rasa, for every formulation we will have to spend 2 to 3 hours minimum. The beauty of Khalviya Rasayana is something that we have to understand. We know that all these Khalviya Rasayana, they are prepared by grinding the materials in Khalvayantra. So here, Mardana and Bhavana are important processes that are involved. Grinding helps for particle size reduction. Grinding helps to expose the unreacted surface and improve the surface area available for interaction. And the most important part is Bhavana. You know the tribochemistry involved in Bhavana. You know the importance of levigation, how it can bring about physical, chemical, biological changes in the material. It not only reduces the dose, but also improves the biological efficacy, absorption, bioavailability. It can modify the drug form into an easily absorbable, acceptable form. It helps not only to form inorganic compounds, but also to form organometallic complexes in the product. So you can increase the potency, you can reduce the dose with the help of Bhavana, which is possible in the case of Khalviya Rasayana. The most basic type, that is Kajjali. Unfortunately, we are not using Kajjali alone in our clinical practice. Kajjali we just skip. We say that this is the characteristic feature of Kajjali. These are the tests to be done. What about its clinical use? Acharya Sadananda Sharma has mentioned very specifically Sahapananupanaanam Vaishishtyadiha Kajjali Sarvamaya Hara Prokta, and also Mata Dosha Trayapa. Vidoshahara Sarvamaya Hara clearly mentions that it is a versatile drug. I must remember the contribution of Dr. Bhaskara Vishnu Gokaleji, who was the first principal of that time Jamnagar Ayurvedic College, which became IPGT and RE and now ITRA, who has authored Chikitsa Pradipa. I quote the references from Chikitsa Pradipa in most of my lectures. He tried to develop several such formulations incorporating herbal drugs with a mineral mercurial base. Tattura Mula Surasabhavita Kajjali is one such example. Haramala Pottari is another example. So where he could incorporate Kajjali base and make it therapeutically more useful and efficacious. So this is possible in Khalviya Rasayana very well. Another beauty of Khalviya Rasayana is that we can incorporate multiple other types of formulations in Khalviya Rasayana. Bhasmas, in addition to Kajjali, there can be Bhasma. There can be Kupi Pakva Rasayana. There are many such Khalviya Rasayanas which do contain Rasa Sindhura like components. The formulations like, for example, Chandamarutha Chenduram, even though it is not basically an Ayurveda product, a Siddha product, an excellent product in the management of psoriasis for topical application with butter or coconut oil, or internally in the case of certain types of cancer and rheumatoid arthritis, is prepared by giving bhavana of Stridugdha or Bodugdha for a couple of Kupi Pakva Rasayanas. That includes Savira, Rasakatpura, Rasasindhura, and so on. We have formulations like Kravyada Rasa, where Parpati is incorporated in a Khalviya Rasayana. So these are all the specialties of Khalviya Rasayana which I wanted to mention here. And we have several of them at our doorstep to practice, but again confirm the quality of them. Next category is the Parpati Rasa. Parpati has its own unique advantage in clinical practice. Literally, it means a thin, brittle, flake-like structure. And this flake itself is referred as Parpata or Parpatica. We are applying heat here, and it is a momentary heat, a short heat shock. And the heat applied may be mandagni, may be ranging from 120 to maximum 200 degrees centigrade, just sufficient to melt the base Kajjali that is present in all the Sagandha Parpati. You may be using a higher temperature in Nirgandha, Rasahina Parpati like Kshara Parpati. And this heat treatment is very unique and very important. In addition to that, we are using certain environment and apparatus to process Parpati. Mandagni, that is related to the heat. Gomaya, use of cow dung platform. Kadali Patra, it may be other Patra like Vatapatra and even Arka Patra for that matter in Tamra Parpati. Parpatakar, all these have their own significance in Parpati. On individual terminology, there are several studies that have been carried out, which may be out of focus of today's presentation. In the case of Kadali Patra, you know that it contains chlorophyll. It has got a certain phytoconstituents which help in improving the bioavailability of the drug, in improving the antioxidant potential of the drug. Even though it is a momentary contact, it is possible that some organic materials from Kadali Patra can enter the Parpati and it will show therapeutic significance. In the case of Tamra Parpati also, Arka Patra has found to incorporate its phytoconstituents into the Parpati, thereby enhancing the Kasahara property of Tamra Parpati. Gomaya, however, the Gopita, Gomaya, whatever the description that are given in many of the textbooks may not have any direct impact on Parpati therapeutically. It's highly unlikely that it penetrates Kadali Patra and reaches Parpati in that short period of time. However, it helps to cool down and see that parpati is produced because that particular change in the temperature from a momentary high temperature to a room temperature is absolutely essential to get the product in Madhyama Paka without causing much denaturing of certain components in the product. Kharapaka is to be avoided except Raudra Parpati. Mrudu and Madhyama Paka, especially Madhyama Paka, has to be used. This is very much essential to establish safety of the product. Most of the Sagandha Parpati have an advantage on intestines, stomach, as Pittadhara Kala and Jatharagni are their targeted action. You take all Sagandha Parpati, starting from Savarpati, Panjamrita Parpati, Loha Parpati, Gagana Parpati, Apra Parpati, Tamra Parpati, whatever is the Parpati that is used. All these have a basic indication related to gastrointestinal tract, like say Grahani. Some will be having very specific and advanced indication, as in the case of Panchamrita Parpati, which is used in Sangrahani, or Rasa Parpati. There also it starts with Grahani. Grahani Gajamardana Dakshatara Kshayakasa Jalodara Gurmahara Atisaramati Brahmadahara Jwara Rogahara Rasa Parpati. Probably all these Sagandha Parpatis have an inclination to act on gastrointestinal tract, to be more specific on intestines. In the case of Kshara Parpati also, I advise to use Kadali Patra. There are differences of opinion. People say that Kshara Parpati, which doesn't have mercury or even sulfur for that matter, can prepare it just pouring the molten mass on a tray. But we have a reference in Rasodhara Tantra where Urdhvadam Kadali Patram Tattva is mentioned. So you will have to compress between the Kadali Patra, which definitely improves the Kshariya Guna of Kshara Parpati, which is the need for us in clinical application. When you talk about clinical application of Parpati, it may be Samanya Prayoga or Kalpa or Vardhamana Prayoga, which are well known to us. I will not elaborate them. In Samanya Prayoga, most probably we are following a fixed schedule. Say, for example, Rasa Parpati, 125 to 250 milligram is given with Prishta Jiraka Churana and Hingu in divided doses. In Unmada and Apasmara like conditions, Rasa Parpati and Panchamrita Parpati are given in a higher dose of up to 8 rattis, around 750 milligram to 1 gram per day. Here, it's not that Pathya are not required, but very stringent dietetic restriction may not be required in Samanya Prayoga of Parpati. Whereas it is absolutely essential in the case of Kalpa Prayoga or Vardhamana Prayoga, where you have to train the Agni, we have to train the intestine for maximum bioavailability of these products. We should see that Agni has improved both Deepana and Pachana properties of Agni are addressed properly. We know that Grahani, Agnimandya, Atisara, Arshas, these are all interrelated clinical pathologies. So naturally, if one is addressed with the help of Parpati, others are also taken care of. You can start with the 2 Ratti, increase gradually up to 10 Ratti and then taper it. Or you can start with the 2 Ratti, increase gradually up to 12 Ratti and taper it according to Chakrapani. So here Pathya are absolutely essential. It is a Kalpa Prayoga, 36, 40, 60 or 96 days, well known to all of you. And this mandala you may have to repeat depending upon the patient's condition. One example I would like to quote here, that is Panchamrita Parpati. There are quite a few references of Panchamrita Parpati. 2 of them are addressed many times. One is from Rasendra Sara Sangraha, which is also quoted in Vaishajya Ratnavali. Second is from Rasamritam, where same 5 ingredients are taken in equal quantity. But here, you cannot prepare Parpati properly. So pharmaceutically and clinically, The most popular version of Panchamrita Parpati is the one which is mentioned in Rasendra Sara Samhita, which we prepare in our practical hall always. Ashtogandhaka Tolakara Sadalam Lovam Tadartham Shubham and so on. Shaudra Ghritanvita, that is the Anupana mentioned. Shaudra Ghrita. Pratidiram Gunjadvayam Vardhitaha. You have to increase Turati every day. That is for Kalpa Prayoga. You have to grind it well. You have to prepare it as a Ravaleha and then administer it. Administer up to 8 Rati or Trigunitam Saptahameva Vajet. 3 times you will have to repeat this mandala, or at least 3 Saptaha you have to give it. These are all the indications, details. I am not going for elaboration because you know about them. What are the specialities with Panchamrita Parpati? Because I am using Panchamrita Parpati regularly in my clinical practice. I consider this as the most useful among all Sagandha Parpatis. I am using this mostly in the Samanya Prayoga form, but with the help of certain diluents which can be considered as Sahapana, like Panchamrita Parpati with Brishta Jiraka Churna, Panchamrita Parpati with Amalaki Churna, or a combination of Brishta Jiraka Churna and Amalaki Churna. The various types of combinations that we are following in conditions like irritable bowel syndrome, in the conditions like malabsorption syndrome, in the conditions like ulcerative colitis, in the conditions like Crohn's disease, and more commonly in the conditions like colon cancer, CS stomach, and also hepatocellular carcinoma. This Panchamrita Parpati I am using in my clinical practice. It gives strength to the Madhyama Koshta. Tamarabhasma present here acts on liver. Lohabhasma acts on colon as a stambhaka. Kajali and Lohabhasma that improve the functioning of Pakvashaya. Abhrakabhasma acts on respiratory system, respiratory centers also, and also acts as psychotropic. Mainly, this is useful in Pitta Pradhana Roga. Tamarabhasma acts as a Pitta Nisaraka here, and it cleanses Pitta Marga Avarodha. It's useful in Agnimanja, in Pitta Sthana. Main seat of action of Panchamrita Parpati are Antra, Yakrit, and also Fufusa. In Chikitsa Prayoga, in conditions like Jirna Sangrahani or Jirna Kshayajanya Atisar, including intestinal tuberculosis, Jirna Amlapittajanya Atisar, which is seen in irritable bowel syndrome like conditions, Rakta Rahita Atisar, you have to give this Panchamrita Parpati with buttermilk or milk depending upon prakriti of individual. According to Yadavji, you can give Panchamrita Parpati modifying it into a form of Saptamrita Parpati. That is, you have to incorporate Vangabhasma and Yashadabhasma and prepare a Saptamrita Parpati, give it alone or give it with Swarna Parpati for best action in intestinal tuberculosis. In Amlapitta, you can give Panchamrita Parpati along with Jahar Mohara Pishti and Draksha Valeka. 250 milligram of Panchamrita Parpati, 125 milligram of Jahar Mohara Pishti, and about half to 1 karsha of Draksha Valeka can be administered. In Vataja Grahani, when there are symptoms like giddiness, dryness of palate, pain abdomen, cutting pain in anal region, frothy bowel excretion, it is ideal to use Panchamrita Parpati with buttermilk, where a small amount of black salt is mixed. There are several studies on Panchamrita Parpati. This is a study reported by Sharma et al., where a 30-year-old male patient with the classical features of Grahani was treated with Panchamrita Parpati. 250 milligram twice a day was given with Takra for 45 days, and the patient had shown excellent clinical improvement. He reported gradual improvement in altered bowel habits, mucus mixed stools, features like fatigue, heaviness of abdomen, indigestion, pain abdomen, and anorexia. One more property I would like to mention is Tamra property. Many practitioners are not at all using Tamra property. It may not be available in the market, but its preparation is very simple. Ideally, you use Arkapatra if it is for respiratory system. Otherwise, you can use Kadali Patra for the preparation of Tamra property. But ensure that the quality of Tamra Basma is the best. That is what we spoke with Dr. Siddhanandan Mishraji, Guruji, in today's session in the beginning, where he has advised us to use a couple of Laghuputas with Gandhaka to ensure the quality of Tamra Basma. I am sure Dr. Gopi Krishna knows very well, as Somanathi Tamra Basma was his post-graduation thesis work also, which is more efficient and easier. And the quality of Tamra Basma can be very well established. Control of temperature is extremely important in Tamra Basma to ensure that it doesn't produce much oxide, which can form other toxic compounds after ingestion. You see that the cuprous sulfide is formed, which is safer. So you have to take care of that. So then when you prepare the Tamra Parpati, it has got certain specific clinical applications. Gunjadvayam Trayanchaiva, Pippali Madhu Sayutam, 2 or 3 Ratti to be given with the Pippali Churna and honey. 3 Saptaratra Yogena Rogarajam Nashayat. In the condition of Rogaraja or Rajayakshma. It need not be tuberculosis. It can be any chronic respiratory conditions like COPD or pneumonia, post-COVID situations. 3 Saptaratra Yogena, that is 3 into 7, 21 days you have to administer Tamra Parpati in a dose of 250 to 375 milligram with the Pippali Churna and Madhu. Ardrakasya Rasenaiva Sannipatam Niyachati. In the Sannipataja condition, Sannipata conditions may be related with Kushta, may be related with respiratory disorders. You give it with Ardrakaswarasa. Trifalarasa Sanyukta Sarva Pandum Vinashaya. In Pandu, wherever the source cause is liver or intestines, use Tamra Parpati along with Trifala Kashaya. Vataritaila Sanyukta Sarva Shula Vinashaya, especially Shula related with the Koshtha or Shula related with Sandhi. Administer Tamra Parpati with Vataritaila, that is air and Taila. Kumari Rasayogena Vata Pitta Upashantikrit. In Vata Pittaja disorders, administer it with Kumari Swarasa. Give Tamra Parpati with Bakuchi, Bija Kashaya in all types of skin diseases. To be more specific, Tadru, where itching is predominant. Trifala Madhu Sanyukta Sarvameha Nivarani in various types of genitourinary conditions, including diabetes. Give it with Trifala Churna and a few drops of honey. Khadirakvatha Panena Kushtha Ashtadashan or Kushta Ashtadashanashini. Tamra Parpati is also called as Kushtanta Parpati. So in Kushta, when you administer it, an ideal Anupana is Khadira Kashaya. So Kasa and Kushta are 2 unique indications for Tamra Parpati. So let me take up next category, that is Kupi Pakvarasana. Even though the preparation is a bit tough in domestic practice, there are many other simplified methodologies to prepare Kupi Pakvarasana. I am sure that Dr. Gopi Krishna and his team teaches this in their various programs. These are extremely important, potent, and useful formulations for us. Probably among all these 4 categories of Murchita Parada, Kupi Pakvarasa is a type of formulation where high degree of heat is utilized. Kramagni is utilized. Higher temperature in Sagandha, comparatively lower temperature in Nirgandha Kupi Pakvarasana. A medium temperature in Talastha type of formulations like Swarnavanga is adopted. Due to this heat treatment, a Kupi Pakvarasa becomes more lakhu, so that it has the capacity to penetrate faster and deeper into the tissues. And this is the reason why the drug will improve Dhatwagni and Jatragni, which is the basis for the treatment of Ayurveda. In all Sagandha preparations and also in the Nirgandha preparations, mercury is converted into a suitable compound where it is not getting dissociated into a free form, but a desired compound and complex is produced. Potency and efficacy of mercury is increased. So we consider that a process of Jarana is established, especially in Rasasindura and Makaradhwaja like preparations. Rasasindura prepared by Triguna, Chaturguna and Shadguna Gandhaka. Similarly, Makaradhwaja prepared by Triguna, Chaturguna, Shadguna, Samaguna are clinically established, experimentally proved for their safety and efficacy by the scholars like Dr. Shraddha Dundi, Dr. Sanjay Khedekar. Many publications are available, you can go through them, how important these processes are. So here, these small dose, rapid action, more potency, long shelf life are very much apt to the Kupipakwa science. Probably because of these attributes, the main target of Kupipakwa Rasayana is in Vata Kapha disorders. To quote the example of Rasasindura itself may not have a direct therapeutic advantage, but it is an excellent bioenhancer. We have seen that Kajali is HGS, Parpati is having a main component as HGS, Rasasindura is HGS, even Rasagarbha Puttali may be HGS. But they are having their own unique therapeutic advantages. Kajali with cubic sulfide as a major phase, with a slightly smaller particle size or crystallite size, but with the same cubic sulfide metacinnabarate as the phase in Parpati, with a smaller crystallite size hexagonal sulfide of mercury in Rasasindura, make them very unique in their therapeutic activity. Rasasindura is a well-established bioenhancer. Whichever the drug that you add to Rasasindura can show more potencified action in a smaller dose and a quicker action. Studies have proved the bioavailability of mercury from both Kajali and also from Rasasindura. Otherwise, there was a blame from the modern counterparts. Pharmacologists used to laugh that HGS you are using, it is not at all absorbed, it is thrown out from the body. But the mercury isotope tracer study has shown that HGS is absorbed and bioavailable. Concurrent administration of Kajali with rifampicin has shown that bioavailability of rifampicin is enhanced to a great extent. Similarly, is the Rasasindura. There are various conditions where Rasasindura can be used with different anupanas in a dose of 1 to 2 rati, 125 to 250 milligram. In Ajirna with Madhu and Musta Kashaya. In Amavata with a Kashaya prepared by using Guduchi, Shatavari, Pippali, Haritaki, Vacha and Shunti. In Apasmara with Vacha Churna or with a Kashaya prepared out of Brahmi, Vacha, Shankapushpi and Ela. In Arshas with Haritaki Kashaya. In Aruchi with Matulunga Rasa. In Gulma with Ajamoda Churna and Vidalavana and so on. There are many such examples. There are at least 20 such different examples quoted in this reference, mainly based on the reference of Rasatarangini. This is a study on Tamakashwasa conducted by Dr. Sorubini and others, where 20 patients were treated with Rasasindura in a dose of 125 milligram BD with a unique anupana of Vibhitaki Falatva Kashaya. For 30 days, 15 days follow-up, CBC with absolute eosinophil count, All clinical features, peak expiratory flow rate were considered for assessment. Outcome of the study has shown that there is very good clinically improvement in cardinal signs like Shwasa Kuchata, Kasa, Dukkhena, Kafanisarana, Gurgratva, Urakpeda, frequency of attack. And there was an improvement in absolute eosinophil count and also in peak expiratory flow rate. Almost 95% of patients responded quite well, and 60% showed maximum response. So probable action is because of the Rasayana property. Action is on Rasadhatu and also in respiratory system. It reaches the alveoli by its Sukshma property and shows its action. Makaradhwaja is another wonderful drug, both Makaradhwaja and Siddha Makaradhwaja. Clinical uses, it is antimicrobial, it stimulates androgenic and adaptogenic actions that help in enhanced immunity defense against invading infections. It nourishes nervous system, it improves the functioning of the nerves, it has anti-aging property, it has aphrodisiac property, nourishes Pradhatu, it is cardioprotective, it is digestive stimulant. Its variants can be tailored for specific clinical action with the help of specific adjuvants. Even in pneumonia, tuberculosis, and chronic cough, it has shown excellent results. I use this in COPD patients. I use this in case of lung cancers primary and also with pleural effusion as a secondary to other type of cancers. Whenever there is a reduced heart rate, bradycardia, this is better. Even in cardiac asthenia, you may be seeing the patients suffering with cardiac disorders who have considerable weight loss. This is very useful. It helps to fight weakness and general debility. It balances three doshas. 125 milligram of Makaradhwaja with 1 teaspoon of honey, betel leaf juice, or a glass of milk is how we have to administer it once or twice a day. In Pittanubandhi Kafaja Kasa, if you want to give it, give 1 part of Makaradhwaja with the 25 parts of Ladhusuta Mishrana, 5 parts of Yashtimadu Churna. So this mixture, half teaspoon BD with honey. In pneumonia, 1 part of Makaradhwaja, 25 parts of Ladhusuta Mishrana, 1/4 teaspoon thrice daily with honey. So during first week, you can give it with Mrityunjaya Rasa. During second week, you can give it with Lakshmi Narayana Rasa in a dose of 1 rati TI. In emphysema, Makaradhwaja 1 part, 20 parts of Sitopaladi, 20 parts of Avipatikara Churna, half teaspoon VD with honey. There are many such prayoga. Considering the paucity of time, I cannot go for much details. I will just mention one more, which I use in my practice, that is bronchogenic carcinoma with chronic cough and respiratory distress. So my formulation would be 1 part of Makaradhwaja, 10 parts of Laghusuta Mishrana, and 20 parts of Sitopaladi Churna, mixed and half teaspoon VD with honey. Just one more Samira Panagarasa from Kupipakvarasa category. I'm not going for the details of its manufacturing. Dose is half to 1 rati according to AFI. Clinically, half rati, 62.5 milligram is sufficient with bitter leaf and honey. It has indications like Sannipata Roga, Kafaja Unmada, Kafaja Sandibandha, stiffness in joint due to Kafadosha, Jwara, Shwasa, Kasa. As the name indicates, it is Samira Pannaga. It is useful in Samira or Vataja disorders. It's just like a serpent to control it. But both in Vataja and Vata Kafaja disorders, it is very, very effective. In Sannipataja conditions, in psychiatric disorders like Unmada, and in Kafanubandhi conditions like Shwasa, Kasa, Pratishaya, Jwara, pneumonia, And even in the case of Pakshaghata and Ardhita like conditions, you can give it with Nagavalli Patra Rasa, or Nagavalli Patra you can use to wrap it and ask the patient to swallow it, or you can give it with Ardra Kaswarasa and Madhu. In Vata Kafaja Shwasaroga, specifically, you can give it with the Tankada and Madhu, or you can prepare a Kashaya by using Vasapatra Yashtimadu Vipita Kiparangi and add small amount of sugar candy and use it as Anupa. You can use it with Lauha Basma in Pandujanya Daurbalya or in Vishamacha. There is a variant of Samira Pannaga that is called as Swarna Samira Pannaga, where Swarna Varka is incorporated. Its dose is half to 1 rati with Madhu, Ardha Karasa and Madhu alone. So this is the market sample of Samira Pannaga and Swarna Samira Pannaga both. Clinically, very useful in cerebrovascular accident where hemorrhagic stroke is the phenomenon, hypertension is the cause. In early stage, in acute stage, Samira Pannaga is very useful. It brings down acutely elevated blood pressure during stroke. You mix 60 milligram of Samira Pannaga with 120 milligram of Chandrapati Pravala Basma and 120 milligram of Loha Basma and administer it. And this is very useful whenever a person has got a sense of blockage in the chest and feels it difficult to breathe. When there is a dryness in throat, person coughs and cannot expectorate out, there is a pain and distress, you can give Samira Pannaga with Sitopaladi Churna and Chavalprasha or honey. This helps to bring out sputum and eases the cough. In Shwasa, wherever the sputum is tenacious, person is unable to bring it out properly, or sputum is thready and sticky, take 30 to 60 milligram of Samira Pannaga mixed with 120 milligram of Pravala Basma and 2 rati of Shuddha Tankada and Madhu for the best result. This can be followed with the Kashaya prepared out of Yashtimadu, Vanapsha, Vibhita Ki Falato, Vasapatra with Sita as fraction. Ardhita is one of the best cases that can be handled with the Samira Pannaga. Even in Vata Kafaja Unvada. Sorry, I will be going a bit quick. I cannot explain all those clinical applications. There are many scientific evidences. This is a clinical study where 52 patients were treated with the Samira Pannaga at a dose of 30 milligram twice a day for 4 weeks with the Nagavalli Dala. The study was carried out by my junior, Dr. Mashru M. And the results have shown that it gives excellent clinical recovery, symptomatic relief, pulmonary functions are improved. There are many researches carried out recently on Tamakashwasa, and various types of Samira Pannaga Rasa were studied. Talastha, Kantastha samples were studied, with Manashila, without Manashila were studied. Talastha sample was found to be more efficacious as antihistaminic, bronchodilatory, and antitussive. Various safety studies are also carried out. Neuroprotective effect are published for Samira Pannaga Rasa. Its clinical study on osteoarthritis in a dose of 60 milligram BD with an Nagavalli Dala was also studied. It's studied on Vata Vyadhi and Amavati. Totally, I am not going for the details because this is the area which you will be discussing much more in your organization's classes. Upi Sangrahani Dukkham Dukkham Bharadvahe Param Dukkhancha Dalika Bhangat Aushadachayam Mahat. This is the reason why Potalikalpa came into practice. Convenience and handling enhances the properties, can be used as an emergency medicine. Sulfur used reduces toxic effect of mercury. It helps for the fixation of mercury. And mercurials, if treated with liquid sulfur, may be therapeutically more efficacious. Drug like Hemagarbha Potali can be used as an emergency medicine, which became popular during COVID crisis. It helped to improve the oxygen saturation In cardiac emergencies, Trinetra Rasa and Hemagarbha Potali are considered to be excellent drugs. Where you have to grind it with Ardra Kasarasa, add a couple of drops of honey, and then administer. In Hridroga, you can use Hemagarbha Potali, Apragarbha Potali. In Rajakshma, you can use Rupeshwara Potali, Hemagarbha Potali, Ratnagarbha Potali. In Prameha, you can use Luhagarbha Potali, Taragarbha Potali, Trithatu Garbha Potali. In Amavata, you can use Rasagarbha Potali and Hemagarbha Potali. In my clinical practice, I am using Hemagarbha Potali, Tamragarbha Potali, Pravalagarbha Potali, then Rasagarbha Potali, and Apragarbha Potali. Only these 5 potalis I have used in the conditions like colon cancer, hepatocellular carcinoma, and bronchogenic carcinoma. I found Rasagarbha Potali and Hemagarbha Potali as quite efficacious and could not get considerable results with other potalis. Probably I will have to work more on them. Bhasma, when I talk about, this is a very focused area that requires much more deliberations. Very unique attributes of Bhasma is what we should always remember. There are several Bhasmas mentioned in our classes: Abraka, Makshika, Vimala, Vaikranta, Rasaka, Kasisa Bhasma, Kakshi Bhasma, Haratala Bhasma, or several Bhasmas of metallic group like Loha Bhasma, Kanta Loha Bhasma, Tamra Bhasma, Swarna Bhasma, Raupya Bhasma, Vanga Bhasma, Nada Bhasma, Trivanga Bhasma, Kansya Bhasma, Pittala Bhasma, various from Sudhavarga category. Then Bhasmas like Kukutandatva Bhasma, Shringa Bhasma. There are many such Bhasmas explained, but unfortunately only a few are in clinical practice. Like say Abraka Bhasma, or rarely Swarnamakshi Bhasma and Loha Bhasma. Then from Sudhavarga, that to Godanti Bhasma, which is having an entirely different type of indication. We must confirm the quality of Bhasma, then you can use it in multiple situations. Because these are very unique type of formulations. All Bhasmas are Rasayana and Yoga. All have immunomodulation, anti-aging properties. All have the capacity of drug carry and targeted drug delivery. All can be used in a minute dose because Mritani Lohani Rasi Bhavanti, Nigranti Yuktani Mahamayanscha, Abhyasa Yogat Drirdeha Siddhim, Kurvanti Rukjan Majaraganash, or Rasi Bhavanti Lohani Mritani Suravandite, Bharate Sakalan Rogan Rasiktani Kimpura, Bharata Dwara Marita Rasabhasma, or Bharata Dwara Marita, any type of metal or non-metallic Bhasmas have their own attributes. These attributes like Rasi Bhavana indicate better absorbable, adaptable, assimilable property, indicating high bioavailability. Shighra Vyapti also indicates the same. Agni Dipana indicates that Bhasma improves metabolism at cellular level also. These are biodegradable, biocompatible, non-antigenic. A huge amount of nanoparticles are observed in Bhasmas. And here most important is the particle size reduction, which is very well established in the conditions like Abraka Bhasma. Unfortunately today, most of these Bhasma preparations, especially Abraka Bhasma, Tamra Bhasma, Trivanga Bhasma, Makshika Bhasma, Loha Bhasma, these are of substandard quality. You don't have to go for any advanced techniques. Just check for Rekha Purnata and Varitara. Most of these passes, the Bhasmas do not pass the test. So then you are liable to cause toxic effect among the patients. So Shatadistu Sahasrantaha Putudeyo Rasayane, Dashadi Shataparyantaha Gade Vivardhanaha. This is what it is said in the case of Abraka Bhasma. It is not so easy to prepare a Nishchandra Abraka Bhasma, which you must have experienced. This is another aspect needs to be addressed. Abraka Bhasma is the only Bhasma which I am mentioning here, which is a very versatile product can be used in a dose ranging from 1 rati to 3 rati, even though the classical dose is 3 rati or 1 valla 375 milligram. You can give it with Rasa Sindhura in Jwara, give it with Madhu and Triphala in Jirna Jwara, give it with Madhu, Triphala to improve the Drishti Shakti, give it with Trikata Churna and Grhata in Grahani, give it with Haritaki and Guda and Sharkara and Ela in Raktapitta, give it with Trikatu and Triphala and Chaturjataka in Pandu, Shaya and Halimaka, give it with Haridra Churna and Madhu for 1 month in various types of Meha, give it with Swarna Bhasma or alone for 1 month in Shukrakshaya, give it with Guduji Sattva for various types of Meha, give it with Swarna Bhasma or Rajata Bhasma to improve Shukra and in infertility, mix it with Bhumyamalaki, Gokshura, Chandrabala, Sita, Godubtha in Daruna Mudra Krich. There is a long list of Amaika Prayoga. You can please go through Rasatarangini to understand how versatile Abrakabhasma is. Its bioavailability is established. Studies have shown that Abrakabhasma contains nanoparticles of the range of 29 to 88 nanometers with ferrous, calcium, selenium, magnesium, potassium, ferric oxide as major constituents. As these constituents are nano-sized, they are more specifically acid-modified moieties. So it readily crosses the lining of GIT. So better bioavailability can be expected here. A study was done with Abrakabhasma along with Chaushashti Prahari Pippali as an adjuvant to anti-tubercular treatment in pulmonary tuberculosis. It was also tried in resistant pulmonary tuberculosis. The dose was 125 milligram thrice a day of Shatapati Abrakabhasma. They used plain water. 250 milligram thrice a day of Chaushashti Prahari Pippali along with AKT. Other group received only AKT. We could see that symptomatic improvement set in very quickly where Abrakabhasma and Chaushashti Prahari was added. At the same time, the therapeutic efficacy of anti-tubercular regimen was also enhanced. There is a study carried out by Dr. Ashmita Avele Madam and her students where she could establish the entire mechanism of Krishna Vajra Abrakabhasma in bronchial asthma. It was found that anti-inflammatory, mast cell stabilization, and arrest or reversal of tissue remodeling are the mechanisms by which Krishna Vajra Abrakabhasma acts. The same thing can be correlated with Ayurveda for Tridoshahara property of Vajrakabhasma. It controls Pitta dosha, which is correlated with inflammation. It controls Kapha dosha, correlated with local excess mucus. It controls Vata dosha, that is responsible for normal or abnormal growth as seen in tissue remodeling, and also in controlling rhythm and direction of breathing mechanism. It improved the peak expiratory volume. It reduced the acute attacks of asthma. In Pishtikalpa, which are the triturated forms, we are using Pishti mainly for certain drugs of animal origin and some precious and semi-precious stones. Most probably those drugs which are to be used in Pittaya conditions, including Hridroga, Pishtikalpana are recommended. Here, levigation or trituration, Bhavana and Mardana are most important factors that are responsible for improvement in therapeutic potency and particle reduction. Wherever cooling action is needed in Pitta disorders, in Ojakshaya and Daurbalya, such Pishti are used. Chandraputi Pishti, like Chandraputi Pravada Pishti, is one of the very unique Pishti. which has more Pittahara action, Vedamushka Arka, rose water, Ketaki Arka. So many such aromatic liquids are utilized for the preparation of pishti. There are many examples. Pishtis like Pravala Pishti, Manikya Pishti, Mukta Pishti, Trinakantamadi Pishti, Akika Pishti are used, out of which Pravala Pishti is very popular. Its target organ is lungs, not just Pitta Vikara. In Yakshma or chronic respiratory disorders, it is very useful. We have a marketed product, Yakuti, which contains multiple pishtis, useful in cardiomyopathy. We have Mukta Pishti, useful in Raktatisara, Raktapitta, Unmada, and Hritroga. Jahar Mohara Pishti is useful to improve the cardiac output. Akika Pishti is also useful in Shiroroga, Hridroga, and Pittajakas. Finally, Lauha Kalpas. These are unique compounds of herbo-mineral formulations with iron as the major ingredient. Mandura also falls under this category, but I have not mentioned that because Mandura itself is a problematic drug. We have to use Mandura, which is at least 60 years old, which is difficult to get. We are rusting the metal Loha by various processes and we are using them. However, still Punarnava Mandura is an extremely useful drug in Pandu, Shotha, Shwasa, etc. This is a very unique application of Rasashastra, where Lauha is or iron is converted into more bioavailable, more acceptable form with the minimum adverse effects like gastric irritation, nausea, constipation, vomiting, etc. Just contrary to the common belief that Lauha Kalpas are Khanuya preparations. They may be churnas, like say Nava is a churna. They may be Avaleha, they may be Rasakriya, they may be Putapaka. There are many forms in which Lauha Kalpas are used. Unfortunately, many are not in clinical use. Only a few, like Navayasa Loha, Saptamrita Loha, Tapyadi Loha, or Dhatri Loha are clinically used. So Dhatri Loha is a preparation which we evaluated in our institute also. We try to find out the action of Bhavana with Guruji Swarasa, the duration of Bhavana and how it is important. So this is an extensive clinical study carried out by CCRS. You will get the entire booklet of around 214 pages online. Please go through them. Published by Srikanth and Dr. Narayanam and others in 2010. This is a multi-centric trial with the Dhatri Lauha. Study was carried out in 12 peripheral research institutes. Preclinical study was carried out, safety and efficacy studies were carried out. After establishing safety in around 458 patients. This particular product, Dhatri Loha, was studied, out of which 400 patients could successfully complete. These were the patients suffering with iron deficiency anemia. Dose was 500 milligram twice a day, with clinical features like weakness, fatigue, palpitation, breathlessness, then pedal edema, all this. So they have evaluated all clinical features and they have taken mean corpuscular volume, hemoglobin, MCHC, serum ferritin, all anemia parameters. Highly significant result in clinical parameters, significant P less than 0.05 improvement in biochemical and hematological parameters could be established. Around 77.25% of patients showed highly remarkable improvement. So let me conclude now. Sorry, I went a bit quickly, and this is very bad time for presentation also. Because of paucity of time, I could not format my lecture to the limitation of the time frame. Anyway, we can have many more such opportunities for discussion. you can always contact me. The risk-related toxic effects of Rasashastra can always be considerably reduced by following good collection practices, good manufacturing processes, good laboratory practices for quality control, and very importantly, following various guidelines mentioned in Ayurveda classics related to administration of drugs. It is the responsibility of all of us in Ayurvedic fraternity to give all the clinical evidences to the scientific discipline regarding the safety and efficacy of the product. To use more and more Rasashashtras without any fear in clinical practice, and prepare as much as Rasashastra is possible simply with simple techniques domestically and use them in our clinical practice. With this take-home message, let me conclude with our regular couple of references. Yatha Visham, Yatha Shastram, Yatha Agnihi, Ashaniryatha, Tatha Aushadam Avidnatam, Vidnatam Amrutotam. So Yogat api Visham Tiksham Bheshajam Amrutopamam, Bheshajam Chap Duryuktam Tiksham Sampattite Visham. So let us process all these raw materials in a judicial manner and let us use them judicially with adequate knowledge so that all these drugs will become nectars for our patients. Thank you very much for your patient listening. Thank you so much for the opportunity.
Thank you so much, sir, for a wonderful session. It was a total power-packed presentation. Like we got many of the informations, a very collective information actually. Thank you so much for your wonderful time and thank you, sir. So going to the next part of the session, I request Dr. Ratnakar Mulik to give his review of the session. How was his journey and all the details. Dr. Ratnakar, you can unmute yourself.
Hello.
Yes, sir.
Hello.
Yes, sir, you're audible.
हाँ सर नमस्ते और बहुत अच्छा लगा IIAR का 1 ईयर कंप्लीट हुआ और इससे बहुत फायदा होता है और मेरी प्रैक्टिस में भी बहुत फर्क पड़ा इससे। पहले जिस कॉन्फिडेंस से मैं औषधि यूज नहीं कर पाता था वो बहुत कॉन्फिडेंस से यूज कर पा रहा हूँ। और सर अभी पोटली भी बनाने की कोशिश कर रहा हूँ। अभी 2 पोटली बन गई है। अभी बाद में और ज्यादा पोटलीज बना के उसको भी प्रैक्टिस में यूज करने का सोच रहा हूँ और यूज करूंगा। शायद उससे बहुत ज्यादा और फायदा होगा। और आपका जो भी कोर्स है मैंने शायद सारे कोर्स किए हैं आपके और सारे कोर्स बहुत अच्छे हैं और बहुत प्रैक्टिकल है। ये प्रैक्टिस में बहुत फायदा करने वाला कोर्स है IIAR। जो भी गोपी कृष्ण सर जो भी लेक्चर लेते हैं वो सारे प्रैक्टिकल है और उसका प्रैक्टिस में बहुत ज्यादा यूज होता है। और मेरा खुद का एक्सपीरियंस ये है कि मैं प्रैक्टिस बहुत एनहांस कर रहा हूँ आपकी वजह से। तो थैंक यू वेरी मच फॉर सच ए ब्यूटीफुल कोर्स एंड इंफॉर्मेटरी एंड प्रैक्टिकल, टोटल प्रैक्टिकल। और ये IIAR जैसे गोपी कृष्ण सर की बायोग्राफी है। सर अपना पूरा क्लिनिकल नॉलेज इसमें डाला हुआ है सर ने। तो कोई उनकी बायोग्राफी पढ़ना चाहता है तो हर एक कोर्स करना पड़ेगा। सारे कोर्स करने के बाद आपका उनका थॉट प्रोसेस पता चलेगा। अगर आपने एक बार उनका थॉट प्रोसेस कैच कर लिया तो आपकी प्रैक्टिस इजी हो जाएगी। और सर का बहुत डीप नॉलेज है और वो सारा उन्होंने खोल दिया है IIAR में। तो वेरी थैंक यू सर, थैंक यू वेरी मच।
ओके, थैंक यू डॉक्टर।
Thank you, Dr. Ratnakar. Yes, we have seen you in every session, and you have like become the premium delegate in our IIAR now. I request Dr. Divyansh to unmute and give his review.
Very good afternoon, everyone.
Yeah.
First of all, I would like to thank Dr. Ramdas Mahanti sir and Dr. Satyanaran Bhatt sir for such an enlightening session, and all the gurus there teaching and helping us to grow via the help of IIAR. IIAR, the Indian Institute of Ayurveda and Rasashastra, has helped me a lot for easy understanding and fruitful understanding of clinical Rasashastra. Thank you so much, IIAR, for letting me present my thoughts, and thank you so much everyone, all the gurus including Gopi Krishnan sir, Jyoti ma'am. Thank you everyone.
Thank
so
you,
much,
Dr.
sir.
Yeah.
Can I now request Dr. Sheila Rani ma'am to share her experience with IIR with us?
I guess there is some network issue. Madam got disconnected, I guess.
Yes, ma'am.
Meanwhile, till ma'am join, I'll request Dr. Mandeep Kaur to unmute. Dr. Mandeep? Okay, there is some network issue. I think they are not unable to do. We have our speaker from our sessions. So I request Dr. Vikram sir to please give his review on the journey of IIR. Sir, please unmute yourself. Yeah.
Yeah, am I audible?
Yes, sir.
Yes, sir.
Good afternoon to all. Good afternoon, sir. Madam and sir, Dr. Gopi Krishna sir. Before I start, I would like to now congratulate and also wish Dr. Gopi Krishna sir. Today, I think his birthday is there, isn't it?
Yes. Yes.
Yeah. Many, many happy returns of the day, sir.
Thank you,
Have a
sir.
wonderful life ahead. It's a great thing that you are doing on the occasion of your birthday. And morning also, I have seen our Gurudev, great Gurudev, Mishra ji, Vidyananda Mishra ji. Really, we are, and you are really great to have such a wonderful teacher who is guiding till today. He is the backbone, I think, he is the backbone for you and your IIAR, Indian Institute of Ayurveda. And wonderful name you have kept, sir. As wonderful you are, in the same way, name is also very wonderful. I am in touch with you since so many years, but last 1 year, 1.5 years, I am observing that you are doing a great job by doing so many seminars, webinars, and all. And also, you are conducting workshops in Ayurveda and especially Rasashastra and Rasashastra, and also an identification of minerals and different minerals, and you are taking the students and Ayurvedic scholars along with you to different places in and around you, and you are teaching them how to identify and get the minerals from the nature itself, from the ore itself. It's really great thing. Nobody can do it unless otherwise they are well versed in this type of identification. Identification is the main actually problem now. Nowadays, we know the theoretical part, but exactly the practically how to identify and how to differentiate one mineral from other, it's a very toughest job actually. That needs a lot of skill and actually a lot of effort which you have faced before doing all these things is really appreciable. Really, our students need such type of in-hand training. What you are giving in, it may be in preparation of Kotali, or it may be preparation of Kupipakura Sayana, or it may be in administering such drugs to the patients and getting the relief from very rare and incurable diseases, as I know from your side, and I have seen your documents also. They are well maintained. Documents are really well maintained and really they are impressive. And even in any of the, you have such a capacity, you can, you can tell to any, you can convince any people in the world actually, in any platform which is given you. Your documents are more than sufficient for Ayurvedic scholars to tell that we are really doing some great work in the field of Shastra and Ayurveda. And I have seen so many patients are praising you. Your patients coming from all over the world, I think, not only from India, in Karnataka. So many patients are there for you. So I really appreciate, and we would like to learn from you, and our students also would like to learn, eager to learn such skills from you. I pray on this great day of your birthday, I pray Lord Dhanvantari and Nagarjuna to give you whatever you want, sir. Not only, I will not limit only to health and wealth. Whatever you want to achieve in your life, let it come to you. God bless you, sir.
Yeah.
Have a
Thank
great
you.
life. Thank you so much for giving me an opportunity to talk in front of you. Thank you so much, sir.
Thank you, sir.
Thank you, sir, for your reviews of the IIAR. May I now request Dr. Sheila Rani ma'am to share her experience.
Thank you so much. We had a wonderful session today with two wonderful speakers who really gave us all the knowledge they had about spinal problems and about Rasa Shastra. Coming to IIAR and Dr. Gopi Krishna, I must say that when I was studying about Ayurveda, I realized that Rasa Aushadhis are very important. But even among our Ayurvedic doctors, there was so much misapprehension and so much of difficulty in prescribing this to the patients. People were scared, there was so much of misinformation going around. So I was really looking around for somebody who is the last word in Rasa Shastra. And I found that Dr. Gopi Krishna is really the last word. He is like an encyclopedia in Rasa Shastra. He's able to go from the macro perspective to the micro perspective.
Join again Zoom link.
So he was able to cover the entire range.
Yeah, ma'am.
So Dr. Gopi Krishna was able to cover the entire range, starting, as I said, from a worldview perspective of Rasa drugs to the micro aspects. So how do you prescribe? What is in each drug? So he gave us a confidence. I think he gave all the participants a confidence that you can prescribe these drugs without getting scared about what everybody is telling you. And mostly you'll find that the Western media really talks a lot of misinformation campaign about Rasa drugs, and many people believe. And a lot of our patients also are in that, so to say, net, and they are very, if you tell them that there is metal in it, then they become very nervous. Can I think about it? Can I tell you tomorrow? In which case, we should be very confident and be able to tell them, don't worry. Or we should not, we should be able to just treat a Rasa drug as any other Ayurvedic drug. So many practitioners themselves are a little scared, and they'll say, this has mercury and this is gandhakam and things like that. So it is like as if you're scaring the patient. But once you are confident about Rasa drugs, you will be able to prescribe it very easily, and it has fantastic effect. And that is what I think Dr. Gopi Krishna and his team have been able to do. So I should congratulate both Dr. Pallavi and Dr. Jyoti for their excellent coordination of this whole thing. And of course, Dr. Ramdas Maganti, I must thank him personally, because when I kept talking to him about Rasa drugs, he said, okay, if you're not happy with only what is happening in the college, I will introduce you to somebody who's a doyen in this. And that is how Dr. Gopi Krishna came into our college and into our lives and was able to teach us so much about Rasa. So on this auspicious day, I think it's the birthday of both Dr. Gopi Krishna and Dr. Jyoti. I'd like to wish them both well. And of course, Dr. Pallavi has to be part of the team. So congratulations to all of you for a wonderful work and a wonderful year of practice. Thank you so much.
Thank you, ma'am.
Thank you.
Thank you so much, ma'am. May I now request Dr. Mandeep Kaur to share her views?
Thank you, Dr. Jyoti ma'am. First of all, Dr. Gopi Krishna sir and Dr. Jyoti Verma ma'am, wishing you many, many happy returns of the day. Happy birthday.
Thank you.
And this session is just so much wonderful. मुझे बहुत ज़्यादा डर रहता था कि मैं कैसे रस औषधियों से ट्रीटमेंट कर पाऊंगी. हम लोग नॉर्थ साइड में इतना ज़्यादा ये ट्रीटमेंट आयुर्वेद ट्रीटमेंट का नहीं रहता, बट अभी रिसेंटली बहुत ज़्यादा ये चीज़ बढ़ने लगी है आयुर्वेदिक ट्रीटमेंट की. तो जब से मैंने सर के सेशन स्टार्ट किए हैं और डॉक्टर ज्योति ने मुझे बताया कि क्या क्या कोर्सेज हैं और मैंने काफ़ी ज्वाइन भी किए और उनको लिसन भी किया, तो मुझे बहुत ज़्यादा कॉन्फिडेंस आया है. और जो भी ट्रीटमेंट रहता है रस शास्त्र का से रस औषधियों से, वो भी पहले से ज़्यादा बेटर हुआ है. तो थैंक यू.
Yeah.
Thank you, ma'am.
Yeah.
विचार करने के लिए. Now I request Dr. Pallavi to give us the calendar of events for 2022.
Yeah, thank you, Dr. Nagveni. Yes, in the whole year of 21-22, we had accomplished lots of sessions. So now our baby steps are over and the toddler has started walking. So we are planning for physical sessions in the future, so which will be very helpful for us to meet and learn more of the Rasa Shastra, because Rasa Shastra is such a science that we cannot learn it in classroom. We have to practice it. So we, the team of IIAR, are planning for next future sessions, which will be more of physical sessions with the online sessions. So to start with, we are hosting a national seminar on Rasa Chikitsa, which would be held between April 30th to May 4th. That is exactly a month after this. So here we have speakers, group of esteemed speakers, which include Dr. M. Gopi Krishna sir, who will be giving us a very beautiful view of the mineralogical identification of the Rasa Dravyas, Potali Kalpas, the method of preparations and their utility. Sir would be discussing on oncology practice with case presentations, thyroid complaints, diabetic management, and few of the commonly asked questions, which would be discussed according to the questions asked by the delegates there, and approach to an unconscious patient. So which would be mainly many of the Divyaushadhi Chikitsas, like the Potalis and Kupis and all, when we have to use specifically in such cases. Because we have in the books, like we can prescribe these Potalis in such conditions and all those. But practicing is a difficult task. So we will learn how it is done and gain confidence on it. Along with this, we will have a hands-on training on Potali Nirmana, Swarnavanga Nirmana, and Rasamanikya Nirmana in the clinical setup. So we will be doing all the 6 methods of preparation of the Rasamanikya. As chief guest, we have Dr. Sridhar Bairi sir, who is a practitioner, wonderful practitioner and a Dravyaguna postgraduate from Udupi. And sir would be discussing simple remedies for practice. So a very regular pattern of medications, probably we think like, okay, this, but how beautifully they help us in the treatment modalities. And we have Vaidya Rajesh Thakkar sir, who is an MD and Chief Ayurveda Physician at Nisarg Ayurveda Hospital and Research Private Limited, Ahmedabad. Sir would be discussing on Garbha Sanskara in Ayurveda and emergency management in Ayurveda with Rasashastra. We have our faculty members, Dr. Ajay Sadanan, Professor and HOD Dravyaguna Vignanam. He is from Palaghat. Sir would be discussing on essential Agraushadis and its utility in the management of Vatavyadis. And sir is a very regular faculty of IIAR. We have heard many of his sessions, many of the interesting sessions from sir. And the other topic sir would be doing would be the hands-on training, that is the demonstration on bandha, which is useful in the knee joint osteoarthritis. And our next faculty is Dr. T. Venugopal Rao, sir. He is a chief physician at Ojas Ayurveda Center, Hyderabad, Telangana. Sir would be discussing on pain management and Ayurveda and would give a live demo on Agni Karma in pain management. Our next faculty is Dr. A.U. Shankar Prasad. So he is an MD DNB and has also completed BAMS, and he is working in as a consultant at Shiva's Health and Research Center, Hyderabad. He would be discussing on the COVID management in Ayurveda. Sir has been practicing COVID management in the modern and the Ayurvedic parts. So sir would be discussing his experience in the same. We have Vaidya Samaji Patil, Chief Physician, Sri Sairam Ayurveda Panchakarma Chikitsalaya and Research Center, Solapur. Sir would be dealing with the topic resolving issues in identifying Divyaushadhis in today's genre. We have our next faculty, that is Dr. Srinivas Reddy, sir. He is a practitioner from Hospet, Karnataka. He would be discussing topic on Rakta Mokshana Chikitsa, which would be a live demo, and also would be giving us a demo on cupping therapy. Myself, I would be discussing on NPST demo on the testing of the bhasmas in the clinical setup, and I'll be discussing few of the Rasashashtras which would be useful in the day-to-day practice. Our next faculty, Dr. Jyoti Verma. She is an associate professor, Punjab Ayurveda Medical College and Hospital, Sri Ganganagar, Rajasthan. She would be giving live demonstration on cosmetic preparations and also will be discussing on the Rasa Yogas. So the enrollment is still open. So you can do the enrollments through the scan code, QR code, or the account details which has been provided here. And once the registration is done, please send the scanned copy, the screenshot of payment, your name, phone number, place, and other details to this number, or you can mail to this mail ID as well. For any of the queries or any of the discussions, we would be available for contact. That is myself, Dr. Pallavi, Dr. Jyoti, and Dr. Gopi sir. All of us will be available for any of your queries. So hope we meet there at the Rasa Chikitsa, the fest of Rasa Shastra. So with this, we are planning to have a physical session every 3 months, so that we can meet each other and prepare the medications. Because when we prepare the medications, we will understand what mistakes we are doing. Just by seeing, just by going through, we cannot understand much. And the best part of our website is that we can, any of the delegates who have not attended our live sessions can buy the courses anytime. All the courses are available in our website. And 2 more days are left for our offer period to complete, as we are as this is our anniversary month. So we have given some of the offers like flat 15% off for buying any of the courses till date of the IIAR. So please avail that offer and gain knowledge. Thank you.
Thank you so much, ma'am, for briefing the year's plan of IIAR. May I now request Mrs. Vasanthi Gopikrishna, ma'am, to give vote of thanks.
Hello, good afternoon, everyone. I'm Vasanthi Krishna, Director IIAR. I do remember the hard times during the COVID era. It was very difficult for regular discussions among the doctors and budding Vaidyas to come across. And so IIAR had taken its existence step to virtual mode, which has accomplished 1 year with a great success by a huge enrollments and contribution of large number of talented speakers. Coming to the anniversary IIAR, it has been a very fascinating, engaging and learning year for me myself. It was not just a coordination or combination, but a huge team working upon the successfulness of IIAR. Heartily, I pray to God for the blissful year of learning and sharing this Jaya's IIR. I bow to the elders of my family, consistently supporting to achieve the goals of IIR. We are grateful to have the most eminent speakers, most eminent person like Professor Siddhinandan Mishra ji and other eminent speakers for building the blocks of IIAR. It was happy on my part to work as a team like family with Dr. Sheila Rani Chunkat, Dr. Pallavi, Dr. Jyoti Verma, and Dr. Nagaveni in this forum. This wouldn't have happened without the technical support of Mr. Pavan and Mr. Vijay, for which I am very thankful to them. We are very thankful to all the delegates who are enrolled and enjoyed and joined Family IIR. It is a great honor for us to extend the classes to become more offline for more interaction between the doctors in the coming year. And one such event is presenting National Seminar Rasachikitsa 2022 to happen from 30th April to May 4th at Ballari, Karnataka. We expect more number of delegates to join us and experience the great discussions. Thank you one and all for being with Indian Institute of Ayurveda and Rasashastra. Thank you. Namaste.
Thank you so much.
Thank you. So with this, we conclude our anniversary celebration of Indian Institute of Ayurveda and Rasashastra. So we are very thankful to all of our delegates who have been patient enough to be here and attend our session. Thank you one and all.
Thank you.
Before we conclude, sir, a very happy birthday to you and as to Dr. Jyoti ma'am as well.
Thank you, ma'am.
So
Thank you very
to
much,
the whole
sir.
team. Yeah, thank you to the whole team of IIAR.
Yes. Thank you, sir.